Before we begin, I would like to welcome Dave Schulist, the new mayor of Madawaska Valley, returning mayor, back to County Council. Mayor Schulist was sworn in as a county councillor on Monday. As we gather here today, we acknowledge on behalf of the County of Renfrew and our community that we are meeting on the traditional and unceded territory of the Omamawinini Algonquin people. The County of Renfrew was established in 1861 on these lands, which have been cared for by the Algonquin people for thousands of years. We express our gratitude to the Algonquin people for their stewardship of this land and honor their rich history and culture. We also thank all the generations of Indigenous peoples who have maintained a deep connection to this territory, and we are committed to fostering respect, reconciliation, and understanding. And at this time, I'll ask everybody to stand for a moment of silent reflection.
Our home and native land, true patriot love in all of us common.
Car ton bras s'est porté l'épée, il s'est porté la croix. Ton histoire est une épopée des plus brillants exploits.
God keep our land glorious and free. Oh Canada, we stand on guard for thee. Oh Canada, we stand on guard for thee.
Thank you. Please be seated. Ms. Dombrowski, would you please do roll call?
Yes, and good morning. Councillor Bennett. Councillor Brose.
Present.
Councillor Doncaster.
Present.
Councillor Donahue.
Here.
Councillor Giardini.
Present.
Councillor Grills.
Present.
Councillor Hodnott.
Present.
Councillor Yon. Councillor Lynch.
Here.
Councillor Mayville.
Here.
Councillor Murphy.
Here.
Councillor Nicholson.
Here, all by myself.
Councillor Service.
Here.
Councillor Schulist.
Here.
Warden Emo.
Present.
Councillor Watt.
Present.
And Councillor Weir. Thank you, and we have quorum.
Thank you. At this time, I'll ask, is there any disclosure of pecuniary interest or the general nature thereof? Oh, Councillor Nicholson.
Thank you. I will be declaring for the closed item.
Thank you, sir. Noted. At this time, I'll ask for an adoption. I've got a resolution that the minutes of the County Council meeting of April 23rd, 2025 be adopted. May I have a mover and seconder to get it on the floor, please? Moved by Councillor Brose, seconded by Councillor Mayville. Were there any errors or omissions? I see none. I'll call the vote. All in favor? Thank you. And at this time, do not adjust your sets. I am not Peter Emo. Peter is joining us by Zoom this morning. And I do apologize. I'm suffering from allergies. So if you see a tear coming down my eye, I'm not crying, although I cry in this chamber a lot, not today. Warden Emo has sent his regrets for not being able to attend this meeting in person. He was invited by Premier Doug Ford to participate in a multi-ministerial meeting alongside members of the Eastern Ontario Wardens Caucus last evening in Toronto, and the meeting included discussions with the Honourable Rob Flack, the Minister of Municipal Affairs and Housing, Honourable Dave Piccini, Minister of Labour, Immigration, Training and Skills Development, Parliamentary Assistant Matt Ray, Ministry of Municipal Affairs and Housing, and the Honourable Vic Fideli, Minister of Economic Development, Job Creation and Trade. The Warden will have a full update for Council in regards to the Queen's Park Advocacy Day in a future meeting. Just as a note, Jennifer Gruntz, Account Manager, Zone 6, Municipal and Stakeholder Relations for MPAC, is with us here today and will be available until 4 o'clock to discuss with any of you property-related questions that you may have. She'll be set up in the Cedar Boardroom for the day. Due to an administrative error which resulted in a late addition to the agenda, I would like to ask for a mover and seconder to approve the delegation of Chris Brennan from Enbridge Gas regarding a franchise agreement, which was ultimately included in your package. So I have a resolution that County Council approve a late delegation addition to the County Council meeting of May 14th, 2025 as presented. Moved by Councillor Giardini, seconded by Councillor Lynch. Questions, comments, concerns? All in favor? Well, that's fantastic because Chris is in the room, so I'm glad that we allowed that. So thank you, everybody. And at this time, I'm going to turn this over to Mr. Davis to introduce our next delegation. Thank you.
Thank you, Acting Warden. Good morning, everyone. I'm pleased to have with us today Miss Ann Pohl, if you could come up, Ann, to talk about their group, the Kitchissippi Ottawa Valley Climate Matters Action Group, to talk about their Earth Day event that was held here at our building. So welcome.
Thank you. Oh, it's so good to have help. We travel in a pack. Thank you very much for hearing from us, and thank you, Madam Chairperson. Is that what you're...
We're not sure what to call me today. There's been a lot of discussion in the last 48 hours.
Okay. Okay, I'll go with Madam Chairperson.
That is absolutely perfect. Thank you.
Okay. Yes, probably you saw, or some of you took the opportunity to see our exhibit for Earth Day month in the lobby here of the climate action postcards that we gathered. And many of you will remember that we were here over a year ago with a petition calling for the climate action, the county to step forward to create a climate action committee that includes all the major municipalities and communities, all the municipalities and communities in the county, engages them in the opportunity to work together. And so we were, of course, delighted when in November there was a decision to move ahead with a climate action committee, and pleased to see the terms of reference that came forward for the climate action committee in January or February. And so today I've brought with me, and I'll be giving them to the clerk to share. Today I brought with me the postcards that come from your community, and with a little letter from us. They come from residents in your community. So I have, as you can see, a bunch of bundles here. There is one community that we got no postcards from any residents, and that would be I'm going to get it wrong in the order, but Head Mariah and Clara. Head Clara Mariah. But we did write a certain note for you and send you a postcard. I mean, we were able to hold events, pop-ups we called them, climate postcard pop-ups in 10 different communities. And of course, those would be the communities where we got the most postcards from, but over those 10, we also got a few from other communities. So everybody's getting postcards except Head Clara Mariah, who are getting a consolation note from us. That's right. And a sample postcard. And an invitation if you're interested for us to have some more discussion with you about the challenges of small rural municipalities, very rural municipalities tackling climate issues, because we've done a lot of research, as council knows. Just turning briefly for a moment to where am I in time? Anybody want to tell me? I have 7 minutes left? Great. We have a few comments about the Climate Action Committee that you're in the process of setting up. Sorry to see that I see that the warden is present with us, and the other member of this committee from council, Rob Weir, is not present today, but I assume he's going to hear what's happening from looking at the minutes and that sort of thing. So anyway, our comments about the terms of reference for the committee, because as you know, we've been working on this, pushing for this Climate Action Committee since the end of 2022. So we've been thinking a lot about the need for it and what it could be doing.
I'm sorry. I do have to stop you. That's not what this delegation was for. It was specifically to present on your Earth Day. And I do understand from staff that we've organized that you will come back and be submitting. Yeah.
Oh, okay, but I don't understand. I didn't know that we were coming back.
Sorry, that's. Oh, I'm sorry. I'm sorry. One of your pack is coming back.
Yeah, but I think she's coming back to talk about the other organization that she belongs with, which is the Renfrew County Health Coalition.
My apologies. I wasn't aware. I wasn't briefed.
She's a member of our group because there are so many health issues related to climate. But she's also the chair of the Renfrew County Health Coalition.
Okay, so if I may, so on the terms of reference, if you wouldn't mind submitting those in writing, I think that all of County Council would appreciate it. And as you stated, the warden, although on Zoom, is not here in the room, nor is Councillor Weir, but I think we'd all like to see your ideas in writing.
Okay. All right, if that's what you want to do, that's fine. So I'll just give these to the clerk here.
Wonderful.
And we'll be on our way then.
And Head Clara Mariah will have their participation medal. Absolutely. I know you don't like being left out. My apologies for stopping you, but we do have to stick to the delegation that's in our...
The ones for Pembroke are in here, yeah. Yeah, we thought that we had invited the deputy mayor from Pembroke, who's been very active on climate issues, to come because we know the committee's planning to engage them. That's
absolutely
not it. But he's teaching today. Whoops, that's the one for Pembroke, and we don't want to leave that one here. We have to take that to Pembroke because he's teaching today and can't be here. So.
Wonderful, thanks so much. Did anybody have any questions? Yes, Councillor Watt.
Not a question, just a comment that I did read through your postcards when they were on the wall out in the lobby area, and I just congratulate you on your participation. Thank you.
Thank you.
Wonderful, thank you for that. I look forward to reading them too.
Okay, there you go.
Thank you so much. Enjoy this beautiful day.
Thank you.
Nobody wants to sit in a council chamber all day anyway. All right, with that, I'm going to turn this over to Councillor Donahue to introduce our next delegation, please.
Thank you very much, Madam Chair. It pleases me no end to welcome back our returning champion, actually, Sabina Mersman. As all of Council will recall, Sabina was here at our last meeting as well. She is the President and CEO of the Pembroke Regional Hospital, but she is here at our committee today because Sabina, along with Chief Michael Nolan, the Chief of the Paramedics for the County of Renfrew, is co-chair of the Ottawa Valley Ontario Health Team. This collaborative effort, of which the County of Renfrew is a partner and agreement holder, the transfer payment agreement holder, is a key driver in advancing access to healthcare services across our region and involves multiple stakeholders. Today, Sabina is here to provide us with an update on the application process for primary care expansion program, and Council is aware of this initiative that is led by Dr. Jane Philpott to move us forward in the province of Ontario. I need also to acknowledge Jema Watt, OVOHT Strategic Implementation Lead, and all of the continued work that she does on behalf of the team. And welcome as well to Dr. Jonathan Fitzsimon, who is here this morning, along with Judy Hill and Paul Morrow, who are partners in the integrated virtual care, that is the integrated VTAC, if you will, RC VTAC, through the, or under the auspices of the Petawawa Centennial Family Healthcare Center. So thank you so much for joining us this morning, Sabina. We're looking forward to this presentation. There was a bit of a teaser in my question when you were last here, so very pleased to have you back once again today for this very, very important and compelling presentation.
Great. Thank you so much, Councillor Donahue and Councillor Murphy. Really appreciate you having me back here, and I'm almost feeling like this could be my second home. You know, I seem to be here a fair bit. Okay. We'll go to the kind of a bit of a, Tina, I know you explained to me, oh, there, it's just a bit delayed. That's good. So what I want to talk to you about today is kind of the primary care, the exciting things that are happening right now in primary care development. First, talking a little bit about interprofessional primary care teams, the role that the Ottawa Valley OHT is being asked to play in primary care attachment. Then I have a slide on recruitment that I think is going to make all of us feel a little bit better, and a slide on opportunities and challenges. So you had mentioned Dr. Jane Philpott, and I think with her being called to chair and lead the primary care action table has been an incredible advantage for the province. And as an aside, Dr. Philpott actually has been sitting for years at an OHT steering committee at Frontenac Lennox Addington, and we have been in touch with her and that OHT for many years throughout the application process and the development of our OHT. So very much our vision is aligning with their vision on what primary care should look like for the future. So the interprofessional primary care teams, and sorry, we have to learn another acronym. I don't know how anybody is feeling in the primary care world, but between FHTs and FHOs and CHCs and FHCs, it's now we have IPCTs. So it's a new acronym for us. But basically, and it goes back to the vision for primary care. Primary care is the first point of contact, but it's also the most important contact you all have with the healthcare system. And I have been saying this for many years now. The primary care system is the center of the healthcare system. That's how it should be. That's how it should function. Every one of us may have the odd interaction with the hospital, hopefully not too many times. We may have home and community care services. We may have long-term care services and other healthcare services. But your primary care provider should be with you from the day you're born until the last days of your life. And it should ensure continuous, comprehensive, and coordinated care that's patient-centered. That's the big vision. That's what we want to get back to. You know, we had this for a long time. We've kind of fallen away. We want to get back there. But then the difference with the interprofessional care teams is that they're interprofessional teams, comprehensive teams. More than, you know, in the past we would have a family physician. Now these teams may have added allied health professionals. So they may have nurse practitioners and physician assistants, but they also may have directly, in their office, in their area, access to social workers, maybe a dietitian, maybe a diabetes educator, maybe a mental health worker. That is really coordinated interprofessional care, that those physicians can work with all of those allied health partners. And we know that team-based care like that improves health outcomes for patients. And right now, and going back to the presentation that I gave here a few weeks ago, we don't have good outcomes. We see more and more really ill patients in the emergency departments. So what happened in January, actually, and I think all of you know this, the ministry came out to say we're going to make a big investment, $1.8 billion to expand or create new family health teams, which is amazing. And then everybody was sitting a bit on hot coals to say, when are they going to tell us what to do and how to go about it? And there had been an expression of interest a couple of years before that was really wide open, and they got a lot of proposals. We put in a few proposals, and out of that we got a big family health team in the Renfrew area, which was great. But so really the rules were not known until April. I can't even remember the exact date, but I know it was like we had 3 weeks or something to put proposals forward. So the people that you see in the back there, including the people that Councillor Donoghue mentioned, but also Dr. Richard Johnson and Megan Jameson came together and worked hours tirelessly over Easter, put the Easter weekend basically aside and said we need to create something because we have such huge unattachment rates, and put these proposals in. Now, how we were asked to put the proposals in, and I was really pleased about that. The ministry actually put a system forward, a systematic approach. They said we're going to look at the postal codes, and we're going to look at unattachment rates in those postal codes. I'm going to talk a little bit more about that. There's a lot of, some people are pushing back right now to say, oh, that was a stupid idea. But really, it was a great idea to actually have a system in place and not just be, out there and without guidance or understanding. And we were invited to put 2 proposals in by May the 2nd based on the postal codes. And I have a nice little picture of our coming up. Oh, there. All right. So we were allowed to put a proposal in for the K8A postal code and the KOJ postal code. And K8A is actually pretty straightforward, right? This is Pembroke. And when you look at the K8A total population, the unattached rate of 7,644, but the unattached percentage, we have been saying for a long time, Pembroke actually has the highest unattachment rate in our OHT, and it needs to be addressed. And then, K8A seemed pretty good, but then KOJ, and this is where, some of the pushback is coming to the postal codes. Of course, everything from Ralphton to Killaloe, Calabogie, and all kinds of areas in between that whole yellow area, which you know well. So that's a lot more complicated and difficult because it's spread across. But two proposals, which was great for us. So I put this slide in because now we have a Primary Care Act tabled in the legislature. And the Primary Care Act, if it passes and it gets approval, is first of its kind in Ontario and likely in Canada, where a real focus on what do we want to do with the primary care system going forward and committing to that going forward. And these are the principles that have been tabled. So ongoing attachment, and we know the plan is by 2029, everybody who wants to be attached is attached, which is amazing, the amazing of a plan. But the important point, again, is connected, interdisciplinary, connected primary care that collaborates with existing community partners. We don't want to duplicate the system, right? We don't want to create new support systems. If there are systems available, we should be connecting with them. Then timely access through both in-person and virtual options, and after-hour service, and then, of course, digital tools. Now, on the digital tools, I have to say, we are doing really well in the OHT. We have a lot of digital tools already available. And a lot of this is in part because of the great primary care network we have in place since 2018. It's actually co-chaired by Dr. Richard Johnson, but they have been doing a lot of work to get online booking up and running, AI Scribe into offices that want to use AI Scribe. The big issue for us is really that electronic medical record, and how do we get that more connected. I talked a little bit about that in my hospital presentation. My big dream and vision is to have everybody on Epic going forward, but it's also an Epic price tag, so we'll have to see. But the province is saying we are actually going to commit to make this better. And then, of course, culturally and linguistically responsive care. We have a large French population in Petawawa area and fairly large in Pembroke as well. And then, of course, we have a large Indigenous population, so we need to pay focus to that. And measure and use data. And we have been doing that. The FHTs especially have to put a quality improvement plan in annually, and they have to respond to data. But it's not measured consistently. Very difficult to measure consistently when we don't have the same electronic medical record. So, people might measure things, but it's, the side of their desk based on their own EMR. It's not comparable often. So we need to get much, much better at that. So what happened? The primary care network went away. There were two groups that worked on proposals, and the OHT then received two collaborative proposals, one from West Champlain and one from Petawawa. And it was wonderful to see all of the work that had been done. And what was wonderful to see is it really aimed to look at the underserviced areas and the high needs areas and the areas that actually are struggling the most with finding personnel to help out. I mean, there are empty nurse practitioner positions available right now, that could be filled. So it's not sometimes a money issue, it's sometimes just simply a staffing issue. The other thing that when we looked at the two proposals at the OHT table, we said those two together would look at 100% attachment for our population in 2027. And we were very happy to see that. So just quickly, the West Champlain proposal, it's 7 partner organizations between family health teams, community health centers, and family health corporation, collaboration. I don't even know, Judy, what the FHC stands for, but something like that. So this is amazing, right? All of these people, all of these leaders came together. There are a lot of physicians associated with all of these organizations. They looked at who do we have available, who is coming up, where do we have employment letters, because these guys have to be ready by July to deliver on this. The ministry said, don't give us like a up pie in the sky kind of plan. We want a plan that actually says, you promise something, you actually can deliver it. So we need to have a signed letter from a physician, a signed letter from an MP to say, we are ready to work for you in July. So with all the work that they did, they can attach 11,000 patients. And like just over 1,000 in the first 3 months, and then up to 11,000 by March 2027. They are planning to cover all 3 postal codes in our area and build capacity around in communities. They want to deliver, of course, interdisciplinary team-based care and optimize full scope of practice for MPs. That's something that CHCs have been doing really, really well, and I think we can learn from them and their practice. Of course, they want to provide access to after-hour care. All of these organizations already deliver both in-person and virtual care options. There's not a single physician in this area right now that's working in team-based care that's not offering virtual options. patients can call them, can video conference and come in for in-person care. So the Petawawa Centennial Family Health Center has partnered with the VTAC and has put in a proposal for attachment expansion that's really addressing some of the areas that are struggling the most, like South Algonquin, Madawaska Valley, Algonquins of Pikwakanagan. Those are the areas where we actually have positions open that we can't fill. So again, a great initiative. It'll be very helpful for those areas to have immediate access. And they're planning to attach 7,000 net new patients by 2027. So between the 7,000 and the 11,000, we'll have 100% attachment by March, like in 2 years from now. This is incredible, right? I'm astounded that we can do that. This is amazing. Again, they want to build capacity across multiple communities with new staffing positions, support especially rural communities, because their model, they have in-person care as well, but their model is largely virtual. They have access 7 days a week, 8 to 8, 24/7, which is absolutely incredible. And also in their proposal, I think with consultation through others, they have a strong protocol now to say when clinicians become available, in-person clinicians, we will transfer patients from the virtual care model to in-person. So I want to focus a little bit on, give you some hope on primary care recruitment, because when we talk about primary care recruitment and unattachment, it always looks really bleak. But we actually added 7 physicians in the last year and a half to our area. There's one in Calabogie, one in Petawawa, and 5 in Pembroke, who come from the Practice Ready Ontario program. I briefly mentioned that last time. These are physicians who have medical licenses from countries that were generally not accepted by Canada. They have undergone a 6-month assessment process and are now placed in rural communities. They have to stay in those communities for 3 years, so it's very important for us to hang on to them. So we need to do whatever we can to keep them. But they are here, and I don't know whether 1,000 patients per physician is the right number, but it's around there. Some less, some more that they will look after. So think about that: 7,000 more patients. And then the residency program at the Pembroke Medical Family Medicine Teaching Unit has now 6 additional residents every year who are ready to work. And we know from past data that around 65% of them actually stick around in the county. So let's say 4 out of the 6, just as a general number, stay every year. That's 4 more physicians every year. That's 8 in 2 years, 12 in 3 years. Each one of those, even if they take on 1,000 patients. So the numbers will start to make sense in a couple of years. We are in a low spot, or we were in a low spot, because we see attachment numbers improving. On the nurse practitioner side, I actually saw a forecast the other day, a Canadian forecast on health human resources for nurse practitioners. Did not look good for the next 5 years, but after that, actually we're going to catch up. But in the county, we have 3 students right now that are going through for nurse practitioners. So they won't have trouble finding jobs as long as we get the funding. And so what's interesting in all of this is that maybe going back a little bit, when we put the OHT application in 2021, we were gung-ho. We thought this was really going to be the next best way for the ministry to create a much better healthcare system for us, and we're highly motivated. I have to say, I would say probably the low point for me was 23, 24, when it seemed we had really not a great direction on where we were needing to go. We were told, look at your own population, figure out what your priorities are. But now, and again, I think it's because of Dr. Philpott and her experience with OHT, she's saying OHTs actually will take the responsibility and attachment to primary care. We got a memo that directly lays out what our job is in this environment. And we are being told, develop and implement a plan to facilitate the attachment and make sure people take their patients from the Healthcare Connect list first. Then look at, how do you do 100% attachment going into 2029, which is incredible. And then also make sure in the meantime, we provide some kind of access to patients who are unattached. So what does that look like? And at the OHT level, we have already had some discussions with JAMA. We're really going to focus hard on developing a plan, a systems plan around prevention and what we can do for the unattached patients until we have full attachment. And one specific thing, they said increased participation in cancer screening. Our OHT already does extremely well in cancer screening. It was a priority for us a couple of years back, and we're doing quite well, but we need to continue on that road and put lots of effort in it. But this has really given OHTs a clearly defined role to the future, and I think we're very pleased about that. So that's the end of my
Thank you
presentation.
so much. It really does feel that we've been on tour together lately, hasn't it?
Yes.
And at this time, I'll open it up to comments, questions. Member from Edmundston Bromley, please.
Thank you very much. And through you, Madam Chair, thank you once again to Sabina. This certainly is a critical issue within the County of Renfrew. There were multiple doctor recruitment initiatives right across the County of Renfrew, typically from a largely driven from a regional perspective. So I'm quite keen on this. We got even up to, and I'm not even sure that the data, what the accuracy of the data is here. At one point in the standing up of VTAC, we had risen to 30,000 unattached because, of course, the then warden for the County of Renfrew, Debbie Robinson, was also employed burning the midnight oil as the recruiter for Pembroke Regional Hospital. And I know that it was much more broad, her mandate, than just the Pembroke region. But as I understand, that position remains vacant since Debbie has left. So this is a critical component for us. I'm just, on a technical perspective, first off, one more acronym, FSA. What is an FSA?
Somebody help me out. It's the first three letters of the postal code, whatever that stands for.
Forward sortation area.
There you go. Thank you.
Okay.
Sorry,
so
Jonathan, what was it?
Forward sortation area.
Forward sortation area. So it would be
So easy.
Canada.
Just rolls off the tongue.
That would be a Canada Post designation then. Okay. So with regards to that, on the map on slide 5, it says that there are 2 FSAs targeted, yet both the West Champlain and the Petawawa Centennial are both citing 3. I note also that there is 100% overlap. That Venn diagram is in fact a circle of the 2 areas, so that I'm assuming that is the collaborative. But I'm quite assured that the member from Renfrew would also ask this question. I see K7 is not included on either of these, and there is a substantial challenge there with 1,885 unattached, almost 2,000 unattached. So that is not named within any of this presentation, but is that still going to be served by these 2, or how will that function?
So my understanding is that we will try our best to serve all unattached patients in the area. The postal codes is not clear. Like, it's nice to see a line there, but it's not linear, right? So, there are people living a little bit outside of those postal codes. There are people right now served in postal codes where the family health team or their team is in a different postal code. So the thought is that we want to attach everyone in the OHT, not exclude anyone. So there's no exclusion.
Follow up?
Yeah, just a second one. Thank you, Madam Chair. So just a question, and perhaps by the Chair's indulgence, if need be, very pleased that Dr. Johnson is present. So I'll direct this question to Ms. Mersman, but I'll leave it open where the answer. So on the West Champlain, which does seem to be largely predicated on the model of having physicians. And as I understand it, given the residency, and I'm assuming that has increased, I think if I understood, perhaps the spots have increased. But my question is that certainly in multiple discussions with the former warden over many years, the model of recruiting physicians has been a challenge. So how would either you, Ms. Mersman, or perhaps Dr. Johnson, so how do we distinguish the current climate or the current need that the recruitment of doctors, and I will be quite clear, I'm unsure what the HR is within the allied health professions, but I know certainly also sitting on the doctor recruitment initiative in Renfrew, when we were looking at doctors that were kind of capping at 800 patients versus the 2,500 that were vacating, that cadre of doctors, when we were seeing an interest in not purely family medicine, but also perhaps emergency room, hospitalist, long-term care, hospice, that was also creating some ceiling on the anticipated rostering of doctors. So
Right.
I'm just questioning the model of recruiting doctors was not meeting our needs heretofore. So how would we distinguish what we anticipate moving forward?
Yeah, excellent question. I'm happy to answer the question because I feel I know a fair bit about this. So the external recruitment has not been working well, for most rural areas. This is where, the slide that we talked about, what's actually coming up with the residents and the fact that those residents, where is that slide there? Those residents, once they stay here for 2 years during their residency and they're exposed to Deep River and Renfrew and Barry's Bay areas, they're exposed to different models of family health teams, 65% in the last few years actually are sticking around. That is what this is based on. And this is not a pie in the sky. Neither one of these proposals are pie in the sky proposals. These guys who wrote these proposals have to have written letters from physicians and from nurse practitioners to say, I'm joining this team. So this is not a vision. This is actually reality. If we get the money, then we have the physicians. West Champlain is saying we have the physicians, and Petawawa is saying we have the physicians to fill these positions. Not only physicians, but nurse practitioners and others as well. So this was part of the proposal. If they cannot fulfill the roster of physicians, then they would not have said we can serve 11,000 and the other one 7,000. It's based on reality.
So I actually have a supplementary to the member's question. Just in the last 48 hours, and you'll excuse me, please, I just caught a snippet of it. The government is proposing that they take away large urban centers from incentivizing doctors to come to their areas because it's an unfair practice to rural Ontario. I don't think it's been sussed out, but I do think as the government discusses it, it will be very interesting for our areas outside of large urban.
Yeah,
So,
good point. The other one is, I don't know, maybe this is a bit of a hope on my part, but Quebec is making big steps on remuneration of primary care physicians. Some of them will not like it, so we're close enough. Maybe there's some hope. But I think the biggest hope is actually grow your own and then retain the ones. And this is where, sometimes some of my board members are saying, what can we do as a community to keep physicians here? And I'll repeat this to council. We need to make sure that physicians have a great environment to live in, that they have recreational facilities, that our schools are good, that they have things to do outside of their work. This is not just about the job, right? They also need to love to live in our area. And whatever we can do to keep those physicians here, so those pro-physicians are generally physicians from other countries, welcome them, make them feel this could be their home and they want to stay and maybe convince more to come. Out of 38 pro-physicians in the province of Ontario, at the OVOHT, we have 7. A huge portion of those physicians are already coming because they're talking to their colleagues and they're saying, this is a great area to practice in. Lots of patients, wonderful people. That, if we have that reputation, then people will come. I've never believed in incentives myself. So.
Thank you, Sabine. Yes, member from Petawawa, please.
Thank you, Chair, and through you, I'd just like to say a big thanks to Sabine and all the members of your team here. You were working under a very tight timeline. It was less than 3 weeks that you had to collect all this data and put these proposals together. And you did it because you care about Renfrew County and the people here and attaching them to physicians. So a huge shout out to all the work that went into getting this done and getting it in on time. I know from previous discussions, you even had to have the right font and the right font size. And there were so many technicalities that you had to deal with. But you got it done, and you got promissory letters from physicians and nurse practitioners, and you did it with all within less than 3 weeks. So thanks for getting it done. We can tell that you really care about it.
Thank you, Gary. I really can't take much thanks, but really it's the folks that are sitting there in the back that deserve huge accolades from all of us. And, these are physicians that, took time out of their weekend away from their families to sit down in a basement somewhere and write a proposal. And a lot of work and time and effort has gotten into that. But it brings me back to the point, we all want the same things. We sometimes don't want the same way to get there, but we all want the same things. And that is really, really important. Let's keep that in mind. We are all in this boat together. We all have the commitment to making healthcare better for our residents, and we need to swim in that stream together. And I think those two proposals are showing us that we can do this, and I think the lobbying is now get them both approved.
Well said, and thank you, Gary. Supplementary.
Yes, fingers crossed that we're successful. Just a comment on my colleague's question about the postal codes, and perhaps, and this is just the way the government does it, but perhaps it's not the best way to separate healthcare teams and all of these proposals. Just a comment on the K8A postal code. For example, everybody thinks of Pembroke when they hear that, but in Petawawa there are 900 homes, probably about 2,500 people, who live within the municipality of Petawawa, but have a K88A postal code. And I can't speak for Laurentian Valley, but I'm sure there's a lot of K8A residents there as well who have a Pembroke address. So were they to, organize this based on municipalities, it may have much different data and much different statistical outlook.
Yeah, it's an excellent point, Gary, and I think that's important. I mean, for me, it was a system, which is good, but I think when we look back to Dr. Jane Philpott and what her thought is around primary care and how it should be actually functioning is, she's saying primary care should be deployed just like the school system to a neighborhood, where you actually have a geographic neighborhood regardless of postal codes. But you have this street to that street, you go to that family health team, and that street to that street, you go to this family health team. And I really do hope that we can get to that in the future, because in my opinion, this is the only way we're also going to be comprehensively attaching home and community care to a primary care system if we actually have it in a geography. So that's the vision for the government. Let's attach those patients first and get our system back up and running. But I think the next step is then how do we get there? And there's actually already a family health team in the Kingston area that is doing that, a new family health team that is attaching people in their geography.
Excellent. Member from North Algona Wilberforce, please.
Thank you, Chair, and through you, excuse me, to Sabina. Excellent presentation, and I'm so pleased to see that there's a real clear direction going forward for the health teams, which I certainly had some questions about previously, like what is the role and what is the goal? But this certainly lays out a very clear path forward. My question is in regards to, you mentioned about the challenge in attracting some of the nurse practitioners. Mm-hmm. Is part of that challenge the fact that, and it's my understanding, maybe you can provide a little more background, that nurse practitioners aren't allowed to bill to OHIP for the services they provide? And does that create a challenge in attracting some of those nurse practitioners?
Yeah, I mean, that's potentially true, but the Health Human Resource forecast that I saw is nurse practitioner demand has gone up this way, and the supply has stayed the same. So now we are increasing the supply, and those two lines are meeting, like closer in 5 years, really close in 10 years from now. Now, nurse practitioners are not only be sought after in primary care, right? In hospitals, we love them, in emergency departments, in hospitalist medicine, there is now a movement afoot for them to be able to bill in 2026. So what that will look like, I don't know yet, but this is a Canadian regulation that has opened that door to billing, and now it's up to the province to figure out how do they move them into OHIP billing codes and such. So absolutely, I think the demand for nurse practitioners and physician assistants is going to keep going up for sure.
How interesting. I have the member from Whitewater and then the member from McNabb Braeside.
Good. Thank you. Warden, acting warden, deputy warden.
It's very confusing up here. I don't know.
Excellent. I just wanted to echo the same comments in appreciation for the work that's being done. I know there's only 11 slides presented today, and I think you did it in 11 minutes, Sabine. So awesome, but it does not represent all of the work that went on behind the scenes, the coordination, the letters that Gary's mentioned, like the work that went into this just stresses the effort that the community of healthcare is put into ensuring primary care is available here in Renfrew County. I do want to highlight one thing and then ask a question. But the first thing, I have to acknowledge that Ottawa Valley Ontario Health Team doesn't represent all of the citizens that we represent in this room. Arm Prior, maybe parts of McNabb Braeside, others are represented by Four Rivers. I would gladly support if those elected officials wanted to invite a similar presentation from that OHT to ensure that we're also representing those citizens in this primary care effort. I would encourage and support that. I love the presentation. It shows two different ways of making sure that we can, one, put doctors in place and attach people, the West Champlain model, and then still be able to capture all of those other communities that we can't satisfy right now with a virtual option. I think it's an outstanding to have the two options. The question is, how do we, what role can we play as elected officials here at the county level to ensure that these two options are duly considered and awarded? How can we help advocate for this? Is there thoughts from the OHT staff or the warden?
That's a great question.
You are much better than us in healthcare at political lobbying. If that is delegations, if that is other forms of advocacy, I think is really needed here. When you look at we have 125 possible proposals. The government is approving 80. Some of them will not be approved, likely. So as much advocacy as we can put forward. The OHT has been asking to have a meeting with our MPP, which will happen next Friday. So Jema, Mike, and myself will be going to meet with him as well. But if there are other avenues, then let's put our best foot forward.
Excellent. Member from McNabb Braeside, yes, and then the warden.
Councillor from Whitewater kind of covered what I was going to speak to. I'm McNabb Braeside, and we are cut out on that little boundary map there. So my question was going to be, how do we get included? I'm sure Arm Prior would like some doctors too. And just so the numbers are out there, I believe Councillor Donohue's referred to that Renfrew section that's cut out with 1,800 plus unattached. We're over 3,000 unattached. So that just that K7 block that's cut out is almost 5,000 people unattached, which by the numbers on that chart would put us third in line. So we would like in on this. And I'm speaking on behalf of Councillor Lynch as well, include us, please.
Then I think that we can organize for Four Rivers to come and do a similar presentation as Councillor Nicholson suggested.
Yes. And
We're not going to make Sabine speak for another OHT.
No, but maybe just to say this is actually something that was not chosen by anyone to take umpire out of the equation for OHTs. This was when OHTs were created, the ministry looked at where do patients go for their health care. And umpire patients tended to go more to West Ottawa, and then Renfrew, Deep River, Barry's Bay kind of stayed more in the county. They looked at that as it was a mathematical exercise. And that's how the OHTs were created. So it's not anything that we want to do. Actually, we would love if umpire could be part of our OHT. It would make things so much simpler when we talk about the OHT versus the county, but that's how it is. But absolutely, you could invite West Ottawa, Four Rivers, to come and do a presentation. Would make total sense.
Thank you. Warden, please.
Yes, thank you. And just further to first of all, thank you, Sabine, for the presentation. And like Councillor Brose, I was a little skeptical when OHTs were formed, and felt that there wasn't, to my eye, enough progress on putting boots on the ground. But I'm very pleased with the progress that's been made and what you're proposing. And also, CEO Kelly and I had copies of the presentation going forward, and have passed those out this week while we were in Toronto. And to the member from Whitewater's thoughts. Yes, I think we have a very definite role, because increasingly, I think ministry officials and government officials are looking at effects and impacts on community. And I think the more of us that attend with the OHTs when they're making presentations, or going on with them to make a presentation to a minister, is better, because they need to see that it's not a disparate part of the community. They need to see that there's connection to municipalities, because we have a significant role, an increasing role, in provision of health, whether it's primary care or follow-up care or long-term care for that matter. And I think those things all have to be sewn together to present to the province. I would suggest one other thing, if I might, Chair, is that we need to press the government on ensuring that whether the province is 4 regions or 6 regions, that the funding applied to each of those regions or develop the region is equal on a per capita basis, and also on needs. So I think there is some fine tuning of how they disperse funds, or how they reward progress. I think that's part of some of the longer term conversations.
I couldn't agree more. I'm going to go back to the member from Whitewater, please.
Yes, thank you, Acting Warden. If it's possible, and I'm sure the clerk will make sure that I stay within my boundaries here, but I'd like to propose a resolution of support for this proposal from the County of Renfrew. And I'd like to say, in addition to that resolution, either a letter or a meeting with our MPP, a delegation, potentially at AMO or earlier if we want to influence the decision-making process. And all of this also subject to also the similar support for Four Rivers.
Okay, so I love your resolution, but in our later on report in our corporate services, there is our delegation requests for AMO in August. Did you want this resolution on top of that as a standalone? And do you have a seconder?
Yes, and yes.
All right. Yeah, no objection. So did who's scribing this? Did you get that resolution? Kind of? Okay, let's do this one more time. Go ahead, member from Whitewater.
So a resolution declaring County of Renfrew's support for this proposal was submitted by the OVOHT. The two, yes. I encompass it as one, but the two, requesting that Warden writes a letter, talks to our MPP, and applies for a delegation to AMO to represent our interests.
For both health teams.
Assuming the second health team presentation is the same.
Excellent. And may I have a seconder, please? The seconder is the member from Amherst Bromley. Discussion on that? A member from Arm Prior, please.
Thank you, Chair. In your first resolution, you mentioned Four Rivers. You didn't in this one, and could we include Arm Prior? Thank you.
Absolutely.
Yeah. Yes, member from Amherst Bromley.
Thank you very much. I am certainly endorse on the southern portion, that is the town of Arnprior and McNabb Braeside, that are wholly within Four Rivers, but we haven't seen that. I'm sure when we see that, I'd be more than happy to have a resolution. I would recommend at this point, since the delegation that is before us is simply the proposals, the twin proposals, collaborative proposals being put forward from the Ottawa Valley Ontario Health Team, that for the purposes of this meeting, we restrict it to that. Either that or we would have to withhold this until we had, I don't want to pass a resolution without having even heard what the Four Rivers proposal is. I'm fairly confident that I will be satisfied with that one, but it seems presumptuous to include that today. And certainly I want to recognize both to Councillors Hoddinott and to Lynch that I have no bias inherent, that I am certainly prepared to do the same for all regions, all sections of the County of Renfrew, but without having had any presentation, it seems a little bit forward.
Okay, I've got the warden, and then the member from Whitewater, and then the member from McNabb Braeside. Go ahead, warden.
Thank you. I think I think this resolution is appropriate, as with the change or caveat that was noted by the member from Amherst Bromley first, and then second, would like to indicate that. Should we get we shouldn't be held to the strictly to the motion about a delegation at AMO, because sometimes one of the things we're working on right now is to work harder to get days like we've had with some of the ministers this week, and so that's the other piece, and then to the Four Rivers. I think we should wait until we hear from them, because as Sabine very correctly noted, the ministry had a numbers game, and I don't mean that dismissively, but part of the numbers from our hospital is the draw from the surrounding area of Lanark County and some of the Fitzroy Harbor, CARP areas of Ottawa as well. So I think Four Rivers is in a slightly different position, but that doesn't mean to say we can't be supportive of them once we hear from them.
Thank you, warden. Member from Whitewater, please.
Thank you. Great discussion on this, and I think it warrants this level of our attention, so thank you. I completely agree with the approach. I would suggest that we take this motion specific to this OHT, as Michael has outlined. We look to replicate the exact same motion for Four Rivers once we've been able to have them here and presented. And I would just, a friendly amendment, if I could, in the resolution, is that the delegation is no later than AMO. If somehow staff or the warden is able to manipulate it happening earlier, I would strongly encourage that. Thank you.
Thank you for that, and I think that that's a very important note. I think that was what I was trying to get across was, what are you looking, like, I think that the AMO delegations are great, but we know that they're 15-minute door knockers, and I think that what the warden is doing right now, where he's at Queen's Park and he's got the eyes and ears of these ministers, is far more effective use of our time and energies. Member from McNabb Braeside, please.
For clarification, so we're going to do two motions, one for, I don't know the acronym, one for the
Ottawa Valley OHT.
and then another one for Four Rivers at a later date?
Yes, so what is being proposed is that we invite Four Rivers to do a very similar presentation as Ottawa Valley has done, and then after that, then we can do the same resolution. I don't think it precludes, if we got a delegation prior to Four Rivers coming, that the warden couldn't speak to both OHTs. I don't think that we're leaving them out at all, but I think it is prudent that we hear from them before we, before we align both of them together. Supplementary?
Yes, thank you. I just want to make sure that we don't get forgotten. I've confirmed with my CAO, we had no idea we were in Four Rivers. We have never received any communication from them in any fashion. So we need to get on the radar somehow. But if we're going to have Four Rivers come, then that would be my opportunity to introduce myself.
Okay, might I suggest that you, on a break, perhaps meet up with the member from Iron Prior, and you can discuss Four Rivers. Unfortunately, I think that you're the only two in the room.
Yeah.
Yeah, I don't want to leave it as a you problem, but if you're not even on their radar, that could be problematic for McNabb Braeside. Member from Iron Prior, please.
Thank you, Chair. Just to echo from McNabb Braeside, when you're in the discussions with whatever discussions you're talking about, the last word out is, don't forget about Iron Prior.
Right.
Thank you.
Might I suggest, would it be appropriate to give staff direction to invite Four Rivers if the warden was the warden's got his hand up. Warden?
Yeah, yes, just two real quick things to the members from Arnprior and McNabb Braeside. In the past, when the OHT model was offered up, there was considerable pushback from the mayors of the day, meaning Mayor Packett and Mayor Stack. They were quite concerned about being located and serviced by an OHT that was not Renfrew County based, and they recognized the bind that put a lot of programs in that service Arnprior that are funded from the base of Renfrew Victoria Hospital or Pembroke Regional, and some of the other associated not-for-profits. So that was, and it's unfortunate were not made aware of it, but I can certainly attest to the efforts that Mayor Packett and Mayor Stack made. However, the decisions to include your communities were made elsewhere, and I believe with the support of the Arnprior Hospital Board of the day. And yes, we'll certainly, you don't need my permission, but I think the clerk is well able to make the call to bring in Four Rivers, and I would hope we could do so very soon. Thank you.
Thank you, Warden. So if I may, I need a mover and seconder to suspend the rules to allow Councillor Nicholson's, moved by the member from Abbotston Bromley, second by the member from McNabb Braeside. All in favor? Our rules are suspended, and now we've got a resolution on the floor to plan a delegation, send a letter, and basically do anything we can do to get our OHTs on the agendas for the Ministry of Health. So I have a mover and seconder. Is there any other discussion on that resolution? Member from Whitewater, please.
Sorry, just to add, strongly endorse.
Strongly endorse.
Both options. Thank you.
I have too soon. Too soon. All right. So all in favor?
Recorded vote, please.
Oh, absolutely. You really, this is Gwen and we're not only missing the warden, we're missing the CAO. So Gwen and I are, we're doing our best up here. You let me know when you're ready. We'll let you go in just a sec, Sabine.
Thank you. Councillor Donahue?
In favor?
Councillor Bennett. Councillor Bennett, are you present? Councillor Brose.
In favor.
Councillor Doncaster.
In favor.
Warden Nemo.
I'm in favor.
Councillor Giardini.
In favor.
Councillor Grills.
In favor?
Councillor Yan. Oh, sorry, she's absent. Councillor Lynch.
In favor?
Councillor Hodnott.
In favor?
Councillor Mayville.
In favor.
Councillor Murphy.
In favor.
Councillor Nicholson.
In favor.
Councillor Service.
In favor.
Councillor Schulist.
In favor.
Councillor Watt.
In favor.
And the motion has passed unanimously.
Wonderful, thank you. All right, so at this time, thank you, Sabine. Thank you to all of you in the back of the room. Your work, as many of my colleagues have pointed out, your work is exemplary. We are so lucky to have you as a team. I do want to know whose basement you were all locked in over those weekends, and did they feed and water you appropriately? But at this time, thank you so much, and it's always lovely to see all of you. Thanks.
Thank you so much.
All right, and at this time, I will turn it over to Mr. Davis for our final delegation of the morning.
Thank you, Acting Warden. A bit of a change of topics here today. So I'm pleased to have with us today Mr. Chris Bennon from Enbridge Gas to talk about franchise agreements. So Chris, if you could come on up. Doing some background about this delegation, I'm looking back at an old bylaw that the County of Renfrew passed back in 2005, talking about the franchise agreement, and not too many people were here. It was signed by Mr. Norm Lemke, and our warden at the time was Bob Sweet. So I'm glad Chris is here to talk about this franchise agreement, what the implications are, and how to move forward. So thank you.
There we go. It's like the old COVID, can you hear me now thing. Thank you, everyone, for a few minutes of your time. I know it's a very busy agenda today. That's a difficult presentation to follow. That's some incredible work, but I did promise, Madam Chair, that I would be efficient and go through this fairly quickly. There's a lot of information in the slide deck that you have in front of you, but happy to follow up with any sort of additional detail we can provide or anything that would be helpful. Again, my name is Chris Brennan. I'm the Senior Advisor for Municipal Affairs at Enbridge for the Eastern Region, which includes the County of Renfrew. I do have a colleague online, Patrick McMahon. Pat's one of our regulatory gurus, so if there are any questions about the regulatory process or anything that I can answer, Pat is certainly here to answer those, or if I misspeak, he'll buzz me and come in correct. So again, I'll go very quickly through this just in the interest of time. First, check to see if that works. There we go. So very briefly, just by way of background, Enbridge Gas Ontario and the County of Renfrew, we've been providing service to the County of Renfrew since approximately 1957, so a long-standing relationship between the organizations. Today, we're proud to deliver gas to approximately 24,000 customers in the county, in 12 of the 17 municipalities that make up the county, through approximately 589 kilometers of pipeline. We do pay tax on every kilometer of that pipe, to the tune last year of roughly $756,000 in property taxes. And you would consider us to be a passive taxpayer. We don't require snow removal, garbage collection, any of those sorts of draws on municipal resources. Whoops, a little eager. There we go. So in terms of the process, so the current, as Jason alluded to, the current franchise agreement between Enbridge and the county expired on April 27th. In the interim, while we go through this process, the existing one will carry forward, so no concerns there. Last year, we did provide a package of information to the county. My predecessor was in place at the time, so there's been some turnover in the 20 years since this came into effect, and turnover at Enbridge as well. So my predecessor would have provided the renewal package that went out. So that includes draft bylaws, draft copy of the bylaw that needs to be brought forward, the resolution, some historical documents from 20 years ago, the agreement that's in place today, as well as copies of this model franchise agreement that we will talk about and some guides that go along with that. Sorry, my eyes are not what they used to be. So in terms of this franchise agreement, so essentially it's an agreement between a municipality that wants natural gas and a system installed within its boundaries and a company that wants to provide that service, so in this case, Enbridge. Provincial legislation requires this agreement, and the Ontario Energy Board, who is Enbridge's regulator, has directed that this current model franchise agreement be used. The terms and conditions in the agreement are set. A version of the agreement was adopted in the year 2000, so it's 25 years old at this point. So it would have been the version that was in place in 2005 when this current, recently expired agreement was put in place. And really, the document provides consistency in the terms and conditions of the agreements between municipalities and the utility to coordinate the construction, operation, and maintenance of the natural gas system. Importantly, it's not a draft agreement that can be negotiated. It is managed and set by the Ontario Energy Board. And to that point, we currently, Enbridge Gas Ontario has over 300 of these agreements in place across the province. They're in place as is without amendments. So it is the standard model for our business. And so the next step today is that we need to go through the process to renew that 20-year agreement. Are you able to advance the slide? I think the clicker is frozen here. There we go. Perfect. So again, very quickly in terms of the process that we go through, so the renewal process begins with the delivery of that franchise renewal package, which went out last year, as I said. The franchise renewal resolution is placed on the agenda of a municipal council meeting. Once that resolution is passed and a bylaw goes through the first and second readings, Enbridge is then able to prepare and submit an application to the Ontario Energy Board for approval. Nothing can happen until those two steps take place. The Ontario Energy Board then takes over and goes through their process, which includes publishing a notice in the local newspaper, opening up an opportunity for folks to participate in the process, to register any questions, concerns, to be a part of that process. Like I said, we can't initiate any of that work until the bylaw goes through the first two readings. There's a 14-day waiting period, so that notice will go on the paper. There's a 14-day period that opens up. And then the Ontario Energy Board will consider all the information before them. This entire process can take between 6 and 12 months, depending on what else is going on and how complex the proceedings become. So we do try to start it as quickly as we can. And the role of the Ontario Energy Board is to adjudicate the application. So as I said, you can see an example of what that notice in the newspaper will look like on the screen. Again, a pretty standard document. The Ontario Energy Board will consider all the evidence before it, and then once approved, they'll issue a decision and an order. That's then returned to the municipality, who put the bylaw through final reading, and that essentially is the execution of the new 20-year agreement. So again, that's a very quick overview, lots of detail in the slides. Pat, is there anything that I missed that you want to highlight?
No, we're open to questions.
Sorry, say again, Pat?
I don't have anything to add, but we're open to any questions anyone has.
So
Good
yeah,
job.
again, sorry, very, very quick run through the process, but I'm happy to take any questions either here or offline.
Thank you. And I will let council know that this will be coming back as a resolution to a DNP committee meeting. But at this time, I'll open it up to questions, comments, concerns. Member from Amherst Bromley, please.
Thank you very much, and thank you, excuse me, for the presentation. Once every 20 years, I won't be here for the next one. I'm kind of curious, in your presentation you had suggested, I think, that there are 300 such agreements in existence. Correct. But I'm curious, and I'm not going to second guess, the need for Enbridge gas as determined by the province. But ultimately, I'm curious why the county of Renfrew would be doing this when I'm presuming each of the lower tier municipalities must do the same thing.
Yeah.
So it seems almost redundant in this instance. I'm presuming that this is a requirement because there does not seem to be a logic to it, and typically regulation is not necessarily guided by logic.
I asked the exact same question.
Madam Chair asked the exact same question this morning, and that is exactly why I have Pat here with me, who's the expert in the process. So Pat, can you talk why the County of Renfrew requires a franchise agreement when we do have them with all of the component municipalities?
Sure. Yeah, the franchise agreement for the upper tier municipalities basically addresses any facilities that we have on roadways or lands that are under the jurisdiction of the county. So we do have transmission and distribution lines along county roads that would be under the jurisdiction of the county. So we need to have, pursuant to the Municipal Franchises Act, we need to have franchise agreements in place with any upper tier municipalities that we transmit through.
Thank you so much for that. And most recently, actually, Cobden Road 8 coming to Eganville. Yes, supplementary.
Thank you very much. So in effect then, it is the property that the physical infrastructure would be located on. So in this event, Admaston Brumley currently is the conduit, though I do have a follow-up question on that. But currently, it is the facilitation of the extension of natural gas from the Cobden area to Eganville, the village of Eganville. So if in fact there was not an agreement with Admaston Brumley that Enbridge would not be permitted to travel on our rights of way, is that correct?
That's correct. There are two things that we need to have in place. One is a franchise agreement that we need to have at the upper tier and lower tier levels. And we also require a certificate of public convenience and necessity, which allows us to construct facilities. Those certificates are only required at the lower tier level because that's where we would have the customers in place. So legislation just requires, or the Ontario Energy Board just requires us to have these certificates in place with lower tier municipalities.
Thank you. And follow up.
Final, thank you, Madam Chair. Again, this is largely, it is crossing Admaston Brumley in order to facilitate the extension to the village of Eganville. However, is this both transmission and distribution, i.e., for those members or ratepayers, property owners in my community on a wayside basis, would they also be afforded the opportunity to be connected to the gas line where it is going to be running, or is that simply a transmission line?
My understanding of that community expansion project was within the scope of the existing project. We were looking primarily at customers within Eganville. A few customers, I think, along the way, but all within Bonnechere Valley, I believe. And we did acquire new franchise agreements with Bonnechere Valley and North Algona Wilberforce for purposes of this project. But if there are lines in the neighborhoods or in municipalities, anyone can apply to acquire service from those lines. There's, depending on the location of the potential customer, there's often a contribution that's required in order to make that connection. Until I see where the customer is located and we do an estimate on the cost to serve that customer, I couldn't tell you if all customers would require to make a contribution, but for sure, anyone in Admaston Bromley or any other municipality within the county of Renfrew could apply for service from Enbridge Gas.
Thank you so much. That's very interesting. Thank you.
Yeah, just for very specific clarity then, and I know that it was addressed at the very end, but ultimately I cannot connect my electricity to a high tension line. That is a transmission line, not a distribution line. But in this instance, the pipe that's going in the ground across Admaston Brumley would facilitate, should there be any property owner willing either to extend it some distance, or if they are on the wayside at relatively inexpensive, I'm assuming, they would be able to tap into that line.
And there is a Get Connected section on the Enbridge website, and I can send you a link to that where customers can go and basically input their information.
Sure, thank you.
Yeah.
But we could verify as well that all of the pipe that happens to be going through the municipalities leading to Eganville are distribution pressure, but I believe they are, but we can verify that and get back to the county on that.
That's fantastic news. Member from Whitewater, please.
Thanks, Chair. 3 questions. First one is, I just noticed that the line does run along Highway 17. Do you have the same requirement to then obtain that franchise agreement with the province? You're obviously, is that, it's not...
Not with the yeah, go ahead, Pat.
Yeah, the franchise agreements are agreements between Enbridge Gas and municipalities. And whether it's a upper tier municipality, single tier, or lower tier municipality, that's what governs who we would have the agreement with. They're approved by the province through the Ontario Energy Board, but the agreements are only between municipalities and Enbridge Gas.
Even when and in some cases, the line may go cross a provincial-owned piece of property.
Yes, that's true. The agreements, as I said, are only with municipalities, so we would look at who would have jurisdiction to make decisions regarding pipeline locations or relocations of pipe along roadways, and that's who you would have the agreement with.
Perfect, thank you. And if I could continue, the second
Please.
one. Looking at the line, I blew up the map. You've indicated that Whitewater is the town of Petawawa. I know Gary would like to expand. But we're not going to give you...
I don't know if I'd use blow up and natural gas in the same sentence.
Good. Final comment. I just Googled some stuff online about franchise agreements and what kind of impact or community feedback that you might get from a notice of hearing or from other similar upper tier levels of government. And I'm going to push it back onto staff when it comes to DMP, but can you offer any insights as to some of the areas of contention that you usually experience in this process?
Yeah, and I'll let Pat kick off.
Well, I could start, and Chris, you could add in, but typically right now, a lot of municipalities have climate action plans, so there's concerns about energy transition and what types of energies are being used in municipalities. So there are obviously concerns there, and we're well aware of that. We have a lot of efforts in place to control our own emissions and the emissions within municipalities. And there are also questions about cost sharing of relocation projects. This template agreement is, as Chris mentioned, 25 years old. There's been suggestions that maybe the wording's not right. There's references to facsimiles that aren't commonly used anymore. And there are references to the Drainage Act. There have been municipalities that have challenged the Ontario Energy Board that the Drainage Act should take precedence over a franchise agreement as far as cost determination and allocation between the municipality and Enbridge Gas, and it has been determined by the Ontario Energy Board and through the court system that the franchise agreements actually take precedence over any other legislation. So that there have been challenges, and there have been suggestions to change even slight wording in the template agreement that over the last 20 plus years that I've been dealing with it, the Ontario Energy Board has not had an appetite to change the template simply because it's in place, as Chris mentioned, with over 300 municipalities throughout the province, and they prefer the consistency, and the board, Ontario Energy Board, has determined that any changes to the template would only take place through a large consultation effort that would involve participation of municipalities, AMO, and whoever else want to be involved.
Yep.
Thank you so much. And I will say, just having gone through the process in the last couple of years, especially with Chris now, that Enbridge has been absolutely an incredible partner in ensuring that all residents' questions are answered, that they know what the rollout is. I mean, Enbridge is making a real mess of Eganville right now, but we're happy to have you. But it's been really a seamless engagement with our ratepayers, which I'm so thankful for. The member from Deep River, please.
Thank you, Madam Chair. I just wanted a clarification. I couldn't find it right at the moment, but I remember reading it that the franchise agreements are to be delivered 12 months in advance of the expiry. And then I believe that our agreement expired in April of this year. So we're...
Yeah, it's sort of, I think there was some transition on our team as well, and I think it landed on a few different desks within the county. So we are playing catch up a little bit on this.
It happens. I'm sure there'll be much more discussion as well when it gets to DMP. And I'm sure staff will be ready to answer any and all questions of getting guffaws down here. Was there anything else? Wonderful. Thanks so much. It's always nice to see you. And thank you, Pat, on screen. Have a wonderful day. Go and enjoy this beautiful weather.
Likewise. Thanks so much, everyone.
Thank you.
All right. At this time, correspondence.
All correspondence received has been forwarded to council.
Wonderful. Thank you so much. And at this time, council, we will take a 10-minute break, please. Thank you. Thanks for the thumbs up there. Yeah. Thank you. Welcome back, everyone. And at this time, I will ask Councillor Brose to present the Development and Property Report to County Council.
Thank you, Deputy Warden. To the Council of the Corporation of the County of Renfrew, members of County Council, we, your Committee of the Whole for Development and Property, wish to report and recommend as follows. The first information item, which isn't included in the package, but I just wanted to remind the county councilors that on June the 12th of this year, there will be a forestry tour that's been organized by DNP and the forestry team, and it's going to be a full-day event, and the details are included in an email that was sent out to all members of County Council today.
I'm sorry, Chair, did you say the 12th? It's the 10th.
Oh, I'm sorry, it's the 10th.
Just because we do have County Council on the 12th, so I didn't want, thank you.
My apologies. So it's June the 10th, and it is in the email that everybody received, so thank you. So information item number 1 is the Renfrew County Mesa Heart Hub update, and that the short-term lease agreement for 156 John Street in Pembroke has been, it expired on May the 1st, but has been extended with 2 potential additional 2-year terms. Moving on to resolutions. The first resolution, increased funding for small business centers of Ontario, which is resolution number DP-CC-250439. Moved by myself as chair, seconded by committee, that County Council send a letter to MPP Billy Deneau, Renfrew, Nipissing, Pembroke, and the Honorable Vic Fedeli, Minister of Economic Development, Job Creation and Trade, in support of the Small Business Centers for Ontario, SBC Ontario. Recommendations and request for increased core funding towards salary wages for Enterprise Renfrew County and all small business enterprise centers across Ontario. The background has been included for your review. Moving to item number 3, bylaws, bylaw enforcement officer for the County of Renfrew and Forests, resolution number DP-CC-250437, moved by myself, seconded by committee, that County Council adopt a bylaw to authorize Municipal Law Enforcement Services, Renfrew, Ontario, to act as bylaw enforcement officer on behalf of the County of Renfrew on County of Renfrew-owned forests. Again, the background is attached, all of which is respectfully submitted by myself as chair and committee members. Thank you, Madam Warden.
Thank you, Chair. We'll move back to information item number 1, the Mesa Heart Hub. Member from Whitewater, please.
Thank you, Special Warden. Question on, and I just wanted to get some amplification on this lease, but within the greater picture of the Heart Hub. This isn't the only piece of infrastructure that will be used by the Heart Hub. This is only representing one component that the Heart Hub is going to provide services at.
I'm going to let Mr. Davis answer that.
Thank you, Acting Chair. Acting Warden. So this is a second piece of the Heart Hub process. So the first piece is the location at 700 McKay Street, where we did the transitional housing. That's the main location for the Heart Hub. This location here that used to be the warming center, now the cooling center, is what we call the triage center, where people can kind of touch base with the program needs in this location.
Excellent, thank you. Anything else on information item number 1? Move on, resolution, the number 2. Member from Whitewater.
Thank you. Really interesting white paper. The question I was hoping that I could ask staff is that when we did our operating plan for this year, I have to remind me, I don't remember, was there additional funding requested for our economic development cell? How does this, is there a number we can attach that's specific to Renfrew County for our own economic development that would be represented in this request?
Mr. Davis?
Thank you, and through you. So this is really looking at our ERC component. So when we work through the budget cycle, and if you recall, our treasurer, Mr. Burke, talked about pulling from reserves to make them whole for this current year. So we haven't had funding. We need the funding to keep that base level, but this is what we're talking about in today's white paper.
Supplementary?
Thank you. Is it, oh, I see he's not here. Is it possible to get that number, what this represents to the County of Renfrew?
I'm sure we can do that. Yeah, thank you. Anything further on number 2? Number 3, by law enforcement. Seeing none, can I get a mover, please?
So moved, Acting Warden.
Thank you. All in favor? And that carries. Now I'll turn this over to Chair Doncaster, please, with the operations report.
Thank you, Madam Chair. To the Council Corporation of the County of Renfrew, members of County Council, we, your Committee of the Whole Operations, wish to report and recommend as follows. Item number 1, make this bigger so I can see it. Bylaw to acquire land, County Road 23, Highland Road, and the recommendation there, and the backgrounds. Item number 2, implementation of community safety zones along county roads, and with increased requests from lower tier municipalities, we've set out to create the draft policy. We'll deal with that. Item number 3, 2 tandem truck plow and spreader units. Madam Chair, do you want me to read the resolution or just everybody can read? So.
And
Resolution number OPCC 250450, moved by Chair, seconded by Committee, that County Council adopt a bylaw to proceed with the tender PWO 2025-03 for the purchase of 2 tandem truck plows, plow and spreader units from Premier Truck Group of London, Ontario, in the amount of $957,052 plus applicable taxes. And you will see the background information that's been provided there. Item number 4, rehabilitation of County Road 71, Mattawatchin Road, resolution number OPCC 250460, moved by Chair, seconded by Committee. The County Council approve contract PWC 2025-73 for the rehabilitation of County Road 71, Mattawatchin Road, from civic address 4882 to County Road 65, Centennial Lake Road, Township of Greater Madawaska, as submitted by Bonashare Excavating Incorporated, Renfrew, Ontario, in the amount of $693,494 plus applicable taxes, and that County Council adopt a bylaw to execute the contract. You'll see the background and the results of the tenders that went out. And yeah, and the budget implications are there also in the background, with the handy-dandy chart that we always see at committee. Item number 5, KMP Recreation Trail Lease and Purchase Agreement with Mississippi Valley Conservation Authority. Resolution number OPCC 250461, moved by Chair, seconded by Committee, that County Council adopt a new bylaw that includes the execution of a purchase and sale agreement and a lease agreement with Mississippi Mills Conservation Authority for the KMP Recreational Trail from the County of Renfrew border northward, approximately 6.7 kilometers, and that a bylaw 11223 be repealed. The background is there, and the reason there's the sale agreement and lease agreement is while the sale agreement goes through its little process, we'll lease it so that we can start doing some work on that. And there's apparently a fair bit of work to be done. Item number 6, fabrication, supply, relocation, and rehabilitation of access control gates. Resolution number OPCC 250462, moved by Chair, seconded by Committee, that County Council approve contract PWC 2025-09 as submitted by GP Splinter Forest Products Limited, Pembroke, Ontario, for the fabrication, supply, relocation, and rehabilitation of access control gates in various locations along county recreation trails in the amount of $148,955.96, plus applicable taxes, and that county council adopt a bylaw to execute the contract. You will see the background there, the results of the tenders, and the implications of that. Once again, with the trail system, we hadn't itemized the budget kind of thing, so it flows out of the pool of money that we budgeted for. And moving forward, we will have that separated out for greater clarity. Item number 7, supply delivery installation of steel beam guardrails on County Road 71, Mattawatchin Road, resolution number OPCC 250466. That County Council approve contract PWC 2025-19 as submitted by Boral Fence and Guide Rail Contractors Limited, Wabashin, Ontario, for the supply, delivery, and installation of steel beam guardrails on County Road 71, Mattawatchin Road, in the amount of $215,231.25 plus applicable taxes, and the County Council adopted bylaw to execute the contract. And you'll see the bids that we received and the financial implications. No, there was nothing else, all of which is respectfully submitted by myself as chair and committee members.
Thank you, Chair. We'll go back to number 1, bylaw to acquire land. Number 2, the community safety zones. Member from Whitewater, please.
Thank you. I just wanted to emphasize that I think this is an important step, and I appreciate the staff's work on it. And I just wanted to confirm in my mind there's a correlation between the implementation of this and our one of the items listed in our AMO delegation items.
For community safety zone, automated speed enforcement.
Yes.
Yes, sir.
Excellent. Thank you. Yeah. I appreciate the correlation.
Number 3, the two tandem truck plows and spreader units. Member from North Algona Wilberforce, please.
Thank you, Chair. And I was just curious, kind of surprised that there was only one tender. Do we know what may have restricted the number of tenders? Is it timelines? Is it the specifications? Or is there anything else that may have just resulted in one tender?
Mr. Perkins.
Thank you, Madam Deputy Warden. Onshore, we did send it out through canoe and bids and tenders, so it was out there.
Supplementary? No.
There was some discussion around the color also.
I hope the warden, oh, he did. He's giggling and giving a thumbs up for those of you that can't see him. Member from Whitewater, please.
Along the same theme as NAW, and I know we talked about this at the committee meeting 2 weeks ago, but this price point is incredible. And I acknowledge that the vehicles don't correspond directly with those that might be used at the municipal level just because of highway requirements. But our asset management plan, as an example in Whitewater Region, has a replacement value of $250,000. We have 10 trucks. If nothing else, this price point is going to force a discussion about how do we deliver this service in the future. And I know the staff have done a lot of work on this before. Please do not lose that work. I think we're going to need to come up with some other solutions because we cannot afford the number of trucks at this price point.
Agreed, and I think actually Councillor Donahue brought that up at the committee, that years ago we budgeted $300,000 for a truck, and now we're at this sticker shock time. So you are absolutely correct. Anything further? Chair, please.
Not extending this any length of time, but I do know the last one that the Town of Deep River bought was right around $500,000. So,
Warden, please.
Yes, and further to the comment of the member from Whitewater, I think at some point there will need to be a serious discussion about coordination of services. At a larger table, and I've often said that that's going to be a conversation that's driven by money, and we had a slight giggle at the color of the truck, but I think it's going to be important, that when there's all white trucks, that there is some coordination between all the municipalities about plowing, so that there's not double coverage on runs, and maybe there's some cost savings there by having a more coordinated approach. But anyway, the member from Whitewater is quite correct. And I think that has to be driven by each one of us in this room as we approach budget, with the recognition we want to serve our ratepayers, also serve the master of a right-sized budget, and at the same time get the job done. Thank you.
Thank you, Warden. And I agree. I think we never want to lessen our service, but we have to learn how to do it better and more efficiently. All right. Number 4, rehabilitation of County Road 71. Number 5, the KMP trail lease. Number 6, the rehabilitation of access control gates. And finally, number 7, the steel beam guardrail on County Road 71. And the report as a whole. May I have a mover, please?
Yes, I would have been faster if I didn't have to read every resolution. So moved, Madam Chair.
Thank you. I wouldn't give in to the peer pressure. There's some peer pressure going on over there. I don't know what to tell you. All in favor? And that is carried. Thank you. We have no consent items this morning. We have no staff reports. And at this time, I have 2 resolutions. The first one, be it resolved that council move into a closed session pursuant to section 239 of the Municipal Act 2001 as amended for the purposes of 2C, which is a proposed or pending acquisition or disposition of land by the municipality or local board, Whitewater Paramedic Base Station. May I have a mover and seconder, please? Moved by the member from Petawawa, second by the member from Head Clara Mariah. All in favor? Oh, I'm sorry, member from Whitewater.
And just a reminder, Chair, that I will be declaring on this item.
Yes, sir, and you have your declaration form. Wonderful, thank you. I also have a resolution. Oh, what? Oh, you want me to do this one? I'm sorry. And we are now unclosed. Or all in favor? We are now unclosed. Welcome back, everybody, and thank you. Staff was provided direction on the paramedic base property. We have no reports from representatives appointed to external boards. We have no notices of motion. We have no members' written motions. Do we have any announcements, member from Arnprior?
Thank you, Acting Warden. On the 8th of May, I had the opportunity to be in St. Pierre de Miquelon, which on the 8th of May, which was the 80th anniversary of the liberation of France. In that I was wearing our Renfrew County jacket with our logo. I met the two presidents, one being the Christian Puget, who's the representative from France, and the president from the community is Bernard Briand, who presented us with their poppy for the 80th anniversary. So I managed to capture two and brought one back for the county. Thank you.
Lovely. Thank you so much. Any other announcements? Member from Deep River.
So just a question for the member from Arnprior. You didn't get fogged in when you were there. The last time I was there, I was stuck for 2 days because the plane couldn't, maybe technology has changed, but plane couldn't take off because the fog was so thick.
That sounds like a first world problem to me. Yeah.
Chair, Army, I went on the ferry.
Okay. Any other announcements? Well, lucky for all of you, I have more rubber ducky tickets to sell. So thank you to all of those. Yes, Mr. Perkins.
Thank you, Madam Chair. May 18th to the 24th is the National Public Works Week. So this celebrates the public works professionals who plan, design, build, manage, and operate the infrastructure that ensures a higher quality of life for millions of Canadians. So next week, make sure you congratulate and look at your public works officials and tell them thank you.
So it's Be Kind to Our Operators Day week. Okay, noted. Anything else? Councillor from McNabb Braeside. For those of you on screen, I'm losing control of the left side of the room. Right side of the room's being really good. Go ahead, member from McNabb.
I'm in the center.
You are in the center.
Just a quick save the date. June 28th, our township will be 200 years old, and we are doing a large event, a grand picnic. Everything is 1825 themed. Foods and games and all of that. Hoping to have some upper level dignitaries come and say their words. So it's June 28th, and it's being held right at our town hall off of Calabogie Road, Russet Drive. And as we get closer, I'll remind everybody again, but you are all cordially invited. We're older than Canada.
Wonderful. I will dust off my bonnet. And everybody remember, not this coming Sunday, but the following Sunday, May 25th, Centennial Park in Eganville is being renamed to Gerald Tracy Park. So come one, come all. Anything further? I see nothing. Any new business? I see none. I have a resolution that the bylaws listed be deemed 3 times and passed, moved by the member from Arnprior, seconded by the member from Laurentian Valley. All in favor? Thank you. And I have a resolution that bylaw 67-25, being a bylaw to confirm the proceedings of the Council of the County of Renfrew at the meeting held on May 14th, 2025, be numbered, deemed read 3 times and passed. May I have a mover and seconder? I'm going to go to the left side of the room. Moved by the member from Amaston Bromley, seconded by the member from McNabb Braeside. All in favor? And finally, may I have a mover, a resolution that the county council adjourn at 11:53 a.m. May I have a mover and seconder, please? Moved by North Algonquin Wilberforce, seconded by Whitewater. All in favor? And we are adjourned. Thank you, County Council. We're 12:45. That seems to be the consensus. Thank you. Sorry about that.
Good afternoon, everyone, and welcome to the Health Committee meeting for the Council of the County of Renfrew. It is 12:45, the appointed time. I am calling the meeting to order. I would first ask Ms. Starkenberg, has the roll been called?
Yes, thank you, Chair, and we have quorum.
We have quorum. Thank you. At this time, I would invite disclosure of pecuniary interest, and if there is any, the general nature thereof, please. I see none. With that, I'd seek a motion to adopt the minutes of the meeting held April 9th, 2025, please. Councillor Giardini, seconded by Councillor Purcell. Any errors or omissions, committee? I see none. All in favor? That is carried. Thank you. There were no delegations or presentations at the time of mailing. I'm presuming that continues to be so. Likewise, for communications. So with that, we're going to go directly to the consent reports. And you will note, and I should have announced that at the outset of the meeting, very pleased to welcome Dean Quad to our meeting this afternoon. Mr. Blackmore was taken ill, or somewhat ill this morning, and was unable to be here. So on very short notice, very pleased to have the administrator from Bonnechere Manor joining us from long-term care. So thank you, Dean. With that, we have on the consent report the long-term care resident statistics, the Ministry of Long-Term Care inspection report, the Renfrew County and District Health Unit inspection report, the engagement of, hopefully I'm pronouncing this name properly, Quinn Lurie as Acting Director of Care at Bonnechere Manor is item number 4. With that, are there any questions on any item on the consent report? Councillor Nicholson, please. And then followed by Councillor Murphy.
Thank you, Chair. Just on item number 1, and I appreciate that it may not be possible to get an answer, but I recognize that the number provided in the third table, the total number of folks that are on a wait list for long-term care in the county, I believe it's decreased. Now, I didn't have time to go back and look at the previous report, but is it possible to confirm if that's been decreased or?
I will yield, Mr. Quad, if and I want to be very careful not to call you out on this. I know you have not had opportunity to kind of come up to speed, but I do wonder if you might have that information at your fingertips.
Thank you. Through Chair to you, Councillor. The previous documentation that I have outlines that there were previously 718 applicants in column 1, so there has been an increase, and then the 232 also the number has gone up, so there were an increase of 157 awaiting long-term care placement, and I believe it was from 232 to it was 218 previously.
Okay, thank you. Follow up, Councillor Nicholson.
Thank you, Chair. That's not the good news I was hoping for. And apropos with tomorrow's Aging at Home Forum, I think it's perfect for that, to be a lead-in for that discussion. The second question, if I could ask, is previous to Committee of the Whole, I believe that the paramedics were looking at this list to confirm how many of those locally in the county are being currently serviced by our community paramedic services, just to get an appreciation for who is, either being serviced by private or caregiver, just to get a better appreciation of the distribution of that support. Is that possible at this time yet?
I would yield the floor to that one to Deputy Chief Grenier. And again, the same proviso. If you have this information at your fingertips, great. If not, we will return to the next meeting.
Yeah, I don't have the information on my fingertip. I have a meeting with Aging at Home manager on Friday, and I hope to get better clarity around these numbers so I can report to the next county council.
Okay, thank you. That concludes. Thank you. Councillor Murphy, please.
I'm okay, thank you.
I agree. Anything further? I see none. Any questions on, just one thing just before we leave there. Of course, it is important to note that the most right-hand column of 1,100 does include 232 individuals that are currently receiving care in long-term care. It is just not their preferred option. So in fact, the 875 are where we are exposed, and I believe that was the number that Councillor Nicholson sought some clarification on, how many may be receiving alternate care through the community paramedic long-term care. Moving on, any questions on the inspection report from the Ministry of Long-Term Care? The health unit inspection report. The management team and the new hire on an acting basis. Once again, I see none. I would seek a motion to, no, we don't do motions yet. Oh, we have to do them both. Thank you. I am able to read the body language of Ms. Van Starkenburg. I have learned that over time, and she is always very accommodating and sitting in direct eye line for me, so that I do not miss that. So if there are no questions, then just bear with me one moment as I get to the consent report for emergency services. There is a single item on the Sierra team training. You may, committee may have seen a post about this training, fairly rigorous and engaged training. Very pleased if you have any questions. I'm sure Councillor Grenier would be more, Councillor Deputy Chief Grenier would be more than happy to respond to any questions. I think this is an outstanding collaboration that we have with our paramedic services, as I've long said, that we are continually selling ourselves here as the natural playground. It is vitally important that we can afford all of those people that come to take advantage of that, that should things go badly for you, we can also come for you and provide you assistance. With that, any questions or comments? Really? Okay. Now then, I guess I am getting, in fact, the nod. So I would now seek a motion to, do we receive or approve these, Ms. Van Starkenburg?
We receive them as information.
We receive them. If only the chair would read that document that you give me all of the time. I would now seek a motion to receive the consent report, please. Moved by Councillor Lynch, seconded by Councillor Hoddinott. One further and final opportunity for a question on either of the consent reports. Seeing none, all in favor. That is carried. Thank you. With that, then, we only have a single discussion report. It is a bylaw, so I would invite Deputy Chief Grenier, if you could please read the recommendation for us.
Thank you, Chair. To you, the committee. The recommendation is to our committee recommend that the County Council, that the Warden and the Chief Administration Officer are authorized to execute and purchase service agreement with Make It Matter, Renfrew, Ontario, for the period of June 1st, 2025 until March 31st, 2027, and that the bylaw be executed.
Thank you very much. Could I have a mover, please? Councillor Murphy, seconded by Councillor Watt. If you could provide the background, please, Mr. Grenier.
For sure. Thank you, Chair. To community, County of Renfrew Paramedic Services being partnering with Make It Matter, and we are successfully approved for a SWAP funding, so a substance use and addiction program. Through this agreement, we have dedicated funding that will go to the paramedic services. So a 0.6 ACP paramedic wage up to $67,404 for the first year, June 25th to March 31st, 2026. And the second year, April 1st, 2026 to March 31, 2027 is up to $83,313. And we also received a 0.4 coordinator up to $36,376 for the first year, and the second year, April 1st, 2026 to March 31st, 2027, $50,000. And this funding is to help to continue the work that we've been doing with MASA through the SWAP fund, and help to continue to support our community, the most vulnerable population experience either homelessness, mental health, or addiction challenge. And with that support, we will we'll continue to do a partnership with all our partners in the community to be able to support that community. Thank you.
Thank you very much, Deputy Chief. And of course, committee will recall SUAP, or the Substance Use and Addiction Program, is an initiative of the federal government. So McKay Manor, and I'm not entirely sure if the federal government refers to them as transfer payment agreements. We are all familiar with the notion of the TPA, which is effectively how these are funded through the province. So ultimately, McKay Manor, in my terminology, is the holder of the TPA. So this is the funding mechanism whereby some of these SUAP resources, financial resources, can displace some of the property tax or municipal component to the MESA program. Is that correct,
yes, sir.
Deputy Chief? Thank you. Any further questions or comments? Councillor Nicholson, please.
Thank you, Chair, and I appreciate I may not be able to answer this today, but I'm curious, this program runs through to the end of March 2027. The numbers are clear here in the background portion. Beyond that point in time, is the intention that the Heart Hub would be able to perform this function, or is the SUAP program that is running through these dates planning to be ceased on those dates? Is there any indication of where we might be going at that time?
Before I hand it over to the Deputy Chief, I would like to take a stab at this. There are a lot of moving parts. Of course, the county and the city of Pembroke had the foresight to go ahead and address the issues through MESA that we were experiencing in our communities. Afterwards, the federal government had this fund, which I think is about 600,000, 1.8 million, I think, over 3 years, 600,000 per year. Then subsequent, the province provided the Heart. So there are a lot of moving pieces now that are associated with this. And we're very pleased now to be able to partnership with both of the senior levels of government. But certainly on an informal basis, my fervent hope is that SUAP is a 3-year funding program. I cannot imagine that we are going to neatly put away this issue in 3 years. Certainly, whether it is going to require advocacy on our behalf, but the federal government is going to continue to need to be at the table. So I'm hoping this will be the first of a multi-year program available through the federal government. But having said that, I would certainly turn it over to the Deputy Chief.
Thank you, Chair, to you, to committee. The Art Hub, I think we're still waiting for the TPA to really understand the allocation of money and position. Through that SWAP funding, we can demonstrate the need and reapply for further funding moving forward. And I think we're also advocating for a few other funding from a provincial standpoint to be able to mimic some other services in the county that have similar services that are receive funding provincially.
Thank you. Any further questions or comments? Oh, sorry, Councillor Renfrew, please.
Don't apologize. I'm hidden in the back. So would those, sorry, through the chair to the Deputy Chief, would those services would include something in the area like detoxification, treatment? I know McKay Manor already has a treatment program, but would this enhance that and add a detoxification as well? Is that the kind of thing we're looking at?
To you, Chair, to the committee, I think what you're talking about is more the role of the Art Hub to start providing different services that we don't have currently in the population. The SWAP funding is more around the outreach component of it and a partnership with addiction services and mental health services to be able to meet patients in community where they are at the moment.
Follow up, Councillor Renfrew.
Thank you. So I'm not being negative, it's not in my nature, but it seems we're doing a lot of outreach, we're getting people, but we still don't have the necessary like detoxification center, things like that. So you can get them to want help, but you're right. I wish the Heart Hub would have came first, and then we could have said, okay, now we need people to round them up. So thank you.
late to the table is still at the table, so very pleased nonetheless. But you are correct, Councillor Lafreniere, is the outreach that MESA initiated is ultimately being continued through the funding through the SUAP. But that's why we are so enormously pleased at our success in an incredibly competitive environment for the heart hubs. That we were successful in that residential and treatment component, because that has to be part of the equation as well. So I certainly do, I'm not arguing with you that the sequence might have been more opportune, but the fact that they are now at the table, I think, is incredibly beneficial to satisfying an enormous need and crisis in our community.
Absolutely. But yeah, thank you.
Thank you. Anything further? I see none, so I would call the question. All in favor? That is carried. And another resolution on the discussion report as a whole, Ms. Van Starkenberg. Thank you. I would now seek that motion, please. Councillor Brose, Warden Emo. Once again, a further and final opportunity for any question. Seeing none, all in favor? That is carried. Thank you. There were no deferred reports. We are at item 9. There were no deferred reports at time of mailing. Likewise, there were no verbal reports. Does that continue, Deputy Chief Lafreniere or Mr. Quad? Anything further? I see none. There is a closed session. The recommendation is that pursuant to Section 239(2) of the Municipal Act 2001, as amended, the Health Committee move into a closed session for the following reason. Item, oddly, it's B. Personal matters about an identifiable individual, including municipal or local board employees, with respect to security services at Bonnechere Manor. I would now seek a mover, please. Councillor Mayville, seconded by Councillor Grills. All in favor? That is carried. We are in closed session. We will provide a couple of moments for those. Welcome back, everyone. Thank you for your patience, if in fact you are watching the stream. With that, then, we have completed item 11 and 12, and now matters arising from closed session. So with that, I would invite Mr. Quad, if you would be so kind as to read the resolution regarding security services at Bonnechere Manor.
Thank you, Chair. Through you to committee. The recommendation that Health Committee recommends the County Council direct the staff to proceed with hiring Protec 5 Incorporated, Pembroke, Ontario, as a security agency at the Bonnechere Manor when required.
Thank you so much, Mr. Quad, and thank you for, on short notice, filling the role today of Mr. Blackmore on his behalf. I would now seek a mover, please. Councillor Brose, seconded by Warden Emo. Any further question or comment? Maintaining that we need to be very careful about open session. I see none. All in favor? That is carried. Thank you. Is there any other new or other business? I see none. With that, then, I'd seek a motion that this meeting adjourn and the next regular meeting be held on Thursday, June 12th, 2025, please. Councillor Service, Councillor Murphy, all in favor? We are adjourned. Please do stay tuned. Following the meeting shall be the Community Services Committee.
Thank you. Good afternoon and welcome. I'd like to call to order this meeting for the Renfrew County Housing Corporation Board. Ms. Van Starkenburg, has roll call been taken?
Yes, thank you, Chair, and we have quorum.
Thank you. Are there any disclosures of pecuniary interest and general nature thereof? I see none. A recommendation that the minutes of the January 15th, 2025 meeting be approved. Could I get a mover and a seconder, please? Moved by the member from Head Claremoraya, seconded by the member from Petawawa. Are there any errors or omissions? Seeing none, all in favor? Carried. There are no delegations or presentations. There is nothing under communications. Item 7, consent report. I'm working from paper and here. So the consent report for the Housing Corporation has got 3 items on it. Are there any questions on any of those items? Member from Whitewater, please.
Thank you, Chair. And I really appreciate the statistics that have been provided in the consent agenda, and I think it's worthwhile highlighting it publicly again. The growing wait list is now at 1,800. 7 to 10 years is the wait list for someone to enter into social housing. I know we've established new protocol to allow reprioritization of that wait list, and I think that's a good step, but even with our current plans to replace 24 units one for one, it does nothing to solve this list. So I would ask, what are our steps? Is the only thing left for us is delegations to the province? Is this an acceptable number of residents from Renfrew County to be on a wait list for 7 to 10 years?
I don't think any number is an acceptable number, but 1,800 is certainly unbelievable. Ms. Patrick, would you like to respond to this, please?
Thank you, Chair, and through you to committee. Good afternoon, members of committee. Certainly, as Councillor Nicholson has indicated, the numbers are growing. At the end of 2024, the numbers on our community housing wait list were at 1,763, and we're now up to 1,811. I think we see the many impacts of poverty in our community, including things that are scattered throughout the reports today around the social assistance rates that are not keeping pace. Low move-out rates, escalating market rents are all putting greater demand on our supply. So certainly, we are doing our best in terms of staff to prioritize our affordability programs to meet those in the deepest needs, but the needs are great. Thank you.
Follow up?
Thank you, Chair. And I just note the allocation of the bedroom sizes and the huge demand for one bedroom. I know we're going to see this later in the report, and I'm fine if you ask me to re-raise this later on when we talk about not-for-profit housing agreements. But is there any opportunity we can help facilitate additional expansion of not-for-profits, not-for-profit housing, their negotiated loans or mortgages that they could get from CMHC? If we can't expand our current holding of facilities, can we facilitate the expansion of others?
Ms. Patrick.
Thank you, Chair, and through you to Councillor Nicholson. Certainly, I think this is a good point of discussion when we do talk about entering into negotiations with our other nonprofit housing providers, which comes up later in the report. That's certainly something that staff have been talking about and looking at. You're correct in terms of what the data tells us is that the majority of individuals on our wait list are single adults that are looking for one-bedroom units. So that's certainly something that we're very cognizant about in terms of planning for our needs. And I think all of the factors that you've noted are things that we have talked about. And certainly, perhaps when we get to that item, the Treasurer can give some comments around some of those provisions financially that we're looking at.
Okay, good, thank you. Are there any other comments on that item? Member from North Algona Wilberforce, please.
Thank you, Chair. Not that particular item, but I'm just looking at the children's services stats for licensed spaces compared to operating spaces for childcare. Is the difference in the licensed spaces to those that are operating spaces, are we not meeting the licensed space capacity because of staffing?
I'm not sure we're on the same report, Councillor Brose.
Okay, so
What are you looking at?
Community Services Committee consent report.
No, we're in Renfrew County Housing Corporation.
Oh,
consent
I'm
report.
sorry, I'm sorry.
You're forgiven. Okay, I believe the warden had a question.
I do, yes. I think if we take a look at the special priority status, and there are 110 on the wait list, and it takes 24 months to clear that for a person to be settled. So my question is, who is on this special priority status? I think I understand that, but I'd like to make sure.
Ms. Patrick, please.
Thank you, Chair, and through you to the warden and to committee. So the special priority placement is a provincially designated category for victims of domestic violence. So that is mandated by the province. Also, just this board did set our own local prioritization around individuals that have come through the MESA program and are experiencing homelessness.
Follow-up, please.
Yes, thank you. So is this and I hate to say this, is this a hook to try and generate specialized funding? Because I think, the government has been clear in the last little while that they want to have a response to intimate partner violence. A 24-month response is not, in my estimation, appropriate. And that's not an indication of our efforts. I guess I would wonder where they were staying in the preceding 24 months and how safe it was. So I think, I'm wondering if we can use this stat as a bit of a crack to put our fingernails in to rip open the wall at community and social services. Thank you.
Ms. Patrick.
Thank you, Chair, and through you to the warden. And certainly fully agree in terms of the advocacy piece, but just also wanted to reassure this board and committee that, although it is 24 months for somebody that is a special priority placement or individual experiencing domestic violence to be placed in one of our RCHC units, certainly that does not in any way preclude us from immediate action from our other programs, such as through our homelessness prevention program and our other financial assistance and support programs, where we would immediately support individuals with helping them to get to temporary safe situations and, facilitating them, moving either to a new safe residence or moving costs or some of those other factors. So just wanted to note that although this is too long for they're an independent unit, we do assist through other programs right away. Thank you.
Thank you, and I was sure that you had a response that demonstrated that we were being responsible.
Okay, thank you. Are there any other questions or comments on the consent report items? Member from Whitewater, please.
Thank you, Chair. Just on item number 3, it has been hammered into my brain at our municipal lower tier meetings, the responsibility we have for drinking water. And I acknowledge, I wasn't aware of this before about Aqua running this one facility, housing facility that we have within the county. Are there other reports that are provided through the year, drinking water standard reports? We get them at the lower tiers. I don't know if I've seen them here or if I missed them at the county level. I just want to make sure that I'm fulfilling my responsibilities as part of this clean water.
Mr. Burke, please.
Thank you, Madam Chair. Through you, there are reports
This is a specific property that just happens to be on a well, not town water. I forget how many units it is, but it's the only one we have, so we haven't really brought attention to it. But yes, we do use the Clean Water Agency to run that. It's a municipal water system, but a very tiny one that only services that building.
Member from Whitewater.
Perfect. Thank you. We have the same situation in Whitewater, in Haley's, where a small community is one well managed by Aqua. I just want to make sure that the same reports I'm seeing at lower tier should come to upper tier. So, but if we can mark that as a follow-up, thank you.
Okay, so the answer is that there are no reports, or that will be looked into more? Because I know there are reports that we get as well for Laurentian Hills.
Through you, Madam Chair, yes, we can provide those at a later date.
Okay, thank you. A member from Arnprior, please.
Thank you, Chair. In Arnprior, anything to do with water, we have a vote, recorded vote, in that we know what the inspection was done and that we approve what the water capability and the quantity and whatever else to go along with water. So if something goes wrong, it's the council that's will be responsible, not just a regular motion. I don't know about Whitewater if you do that as well. Thank you.
Okay, thank you. Member from Edmonton Bromley, please.
Thank you very much, Madam Chair. Just for information purposes, I'm presuming is the director the chief operating officer? That's Ms. Patrick is nodding in the affirmative. I think that perhaps this discussion also that was raised by Councillor Nicholson is likely related to the bottom paragraph, which I have highlighted in yellow as well. And I note that it says, it is important that members of municipal council recognize that they are personally liable even if the drinking water system is operated by a corporate entity other than the municipality. So my question is, what measures are in place to ensure that the operator is legislatively compliant? I.e., I'm guessing that that's what the reports are that Councillor Nicholson is talking about, because I certainly acknowledge that we are responsible, but whether it is by an audit or reporting, that we are satisfied that the operator is operating it in a compliant fashion and not exposing us to liability. So I wonder if is that ultimately what Councillor Nicholson was making reference to?
I believe it was. Warden, did you have something to say? No? Okay. So I believe that the answer to that is that Mr. Burke will be looking into getting these reports brought to council. I can't see you over there. Thank you. Yes. Or DMP will. Okay. Thank you. Are there any other questions or comments? Member from North Algona Wilberforce.
Thank you, Chair. And this time I'm on the right report. And I just wanted to comment on the hoarding initiative that staff have undertaken. I think that's an excellent initiative, and pleased to see the positive results as well. Is there any indication that we might be able to continue that going forward based on the success that has been realized?
Yes, Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Brose. I certainly agree. It was a very productive and positive partnership with the Pembroke Regional Hospital Mental Health Services. That partnership was funded out of our homelessness prevention program funding for the 2024-2025 year. Part of the purpose of the partnership was to build knowledge and capacity within our housing caseworkers, within our staff group, in order to better support individuals and families that are living in high-content households, and to help ensure safety for themselves as well as for other members in the building, and mitigate any risks around, fire safety. So we, did not anticipate, although it was very successful, it was not planned that we would continue to pay for those services. We wanted to pay to build the knowledge of our staff and to really learn from the experts, which we did. Huge thank you for sure to Lisa Schuler, who was did a lot of the mentoring with our staff, as well as Muriel Delorme at the hospital, who oversaw the program. But we think that we're in a better position to support those households. Of course, for us, the primary purpose is to be able to prevent some of those evictions. So when individuals are living in unsafe situations, if we're not able to address those issues, it can lead to eviction. And of course, we're doing everything we can to prevent that. So I think that we're certainly in a much more positive position in terms of our staff's ability and confidence around managing some of these situations, as well as we've had some direct interventions to some of the most at-risk households in our portfolio. Thank you.
Okay, follow-up?
Yeah, just supplementary. I think this was certainly a great investment of those dollars. And obviously that has to also reflect on less of a challenge for the housing staff when it comes to somebody vacating the property and cleaning out the units and dealing with some of the other mold issues that could arise. So I guess going forward, my question is, would it make sense to keep the mental health people from the Pembroke Regional Hospital engaged in also helping with some of these people who are experiencing some of these challenges?
Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Brose. So certainly, as you've indicated, this building the knowledge of our housing caseworkers is helping, the team as a whole. Certainly, Mr. Davis's team, is responsible for some of the repairs and remediation of units that have been, perhaps, neglected for too long, or where there has been high content that has been unaddressed. So certainly, earlier intervention and support for those tenants is positive all around. Absolutely, we could continue to utilize direct service providers in our buildings. However, we are waiting for our 2025-2026 HPP allocation. We had hoped to receive it from the Ministry of Municipal Affairs and Housing by now, but we don't have it in hand. Hopefully, we'll have it for the June committee meeting. But as we've certainly spoken about, and Mr. Davis here sitting to my left and our treasurer can attest to, there's a number of programs that we're trying to pay for through that homelessness prevention program. And with the level of need that we're seeing around some of our rent subsidy programs and our homelessness prevention programs, we just don't have the funds to pay for everything, unfortunately. So, doing our best to build the capacity of our internal staff and to work together as a team for earlier intervention and to use some of the knowledge and the skills that we do have now built internally. And also, this continues to be a service that is available through the Pembroke Regional Hospital, albeit there may be a wait list or not necessarily immediate ability to take on new referrals, but certainly is a service that is offered through PRH on an ongoing basis for the community. Thank you.
Okay. I think member from Bonnechere Valley.
Thank you, Chair. Just on the hoarding, thank you so much for undertaking this. It's an enormous problem, as we know. But when you talk about fire safety, it's not only about the safety of the people that live in the homes, it's also about all of our EMS going into those homes, especially our fire department, where there could be smoke and flames, but also our amazing paramedic service and our OPP, quite frankly. So I think this was very, very, very important and timely as well. Thank you.
Member from Petawawa, please, and then we'll go to the warden.
Thank you, Chair, and through you. And just to build on what Councillor Murphy spoke about in terms of fire services, has the Housing Corp and the Pembroke Regional Hospital liaised or partnered with any of the local fire departments? Because I know in Petawawa we had some hoarding issues and the fire department was very helpful in terms of bringing these to successful conclusions.
Mr. Davis, please.
Yeah, thank you, Chair, and through you. So we have engaged with our local fire service, whether it's in Armpire or Petawawa, when we have situations like this, and they do provide a benefit to our staff when there's a need to have these hoarding issues resolved, because we do know when we engage hoarding in our facilities and the partner facilities, the cost to us to maintain these facilities after we move them out and do this is exponential. And so you'll see in a lot of our budget items, our repair and maintenance costs increase. And it's a direct relation to the hoarding issues that we're facing day to day. So back to your question, yes, we do have a partnership with all our local fire chiefs and fire officials.
Warden, please. I think you're muted.
Thank you. Thank you very much. It's been a very educational conversation, to be honest with you. And I'm most pleased to see item number 4, which is the meeting scheduled for April 29th, where there is some discussion around protocol. Because I think that's standardization or you can't standardize every intervention, but you can certainly put some tenets in place, some basic pieces in place. So that's very encouraging.
Sorry, I hate to interrupt you, but I don't think we're on the same item.
Oh, I'm sorry. I thought the boarding final report.
Sorry, no,
Oh.
I can't see what you're doing, Evelyn.
Sorry, he's on page 4 of the Renfrew County Hoarding Management Report.
Oh, you're into the actual report. Sorry.
Yeah. Sorry. I thought that's that's where we're headed. Sorry.
Okay, sorry, continue then.
So yeah, just I'm sorry, on page 4, item number 4, which talks about the interagency collaboration being in April. So I think that's a very important step to build on the strengths of what we've had to date. Thank you.
Yeah, a lot of reports and a lot of confusion. Okay, are there any other comments or questions on the, where were we, on the consent report? No? Okay, then I got to call it up here. I have a recommendation that the consent report be received as information. Could I have a moved by the member from North Algona Wilberforce, second by the member from Killaloe Haggerty Richards. Any, all in favor? Carried. Thank you. Next, there is nothing for discussion reports. There are no deferred reports, no verbal reports, no closed session, no new or other business. Recommendation that this meeting adjourn and the next regular meeting be held on Thursday, June 12th, 2025, which I believe is to be the AGM for the Renfrew County Housing. Member from North Algona Wilberforce, Admiston Bromley. I can't see, so I've got to go by memory. And seconded by the member from Laurentian Valley. All in favor? Carried. We are adjourned, and we'll take a minute to call up our agenda for community services. Thank you, and welcome back. This is a call to order the Community Services Committee meeting. It is 2 o'clock. And has roll call been taken? Ms. Van Starkenburg, please.
Yes, thank you, Chair, and we have quorum.
Thank you. Are there any disclosures of pecuniary interest and general nature thereof? I see none. Recommendation that the minutes of the April 9th, 2025 meeting be approved. Can I get a mover and a seconder? Moved by the member from Arnprior, seconded by the member from Bonnechere Valley. Any errors or omissions? Seeing none. All in favor? Carried. There are no delegations and presentations. There is nothing for communications. Consent report. There are, I'm just going to call this up here. Community services, there are 8 items on the consent report, and I understand the director would like to speak to the first item, please.
Thank you, Chair, and through you to committee. Thank you very much. It's actually item number 4. It's okay. It's item number 4 that I wanted to speak to just briefly for this committee. It's the poverty analysis report. This was a report that was completed by through our Renfrew County Legal Clinic, and there were a number of measures that were looked at within that report related to poverty. And I know last month we spoke about food affordability, and the report from the Renfrew County and District Health Unit that noted that there are currently 1 in 4 households living that are living in food insecure households at this time, which is up from 1 in 6 households in the previous year. And this committee had asked staff to bring back more information with respect to food insecurity in Renfrew County. So as a starting point for that request, I've included the poverty analysis report for committee's information. Specifically on page 16 of the report, there is a section that talks about the food insecurity and food bank usage and how it's escalating, locally. And just as a note, I have engaged with the local food banks in Renfrew County to try to bring back some specific data for this committee with regards to their numbers. We do know anecdotally that they are all seeing increased volume and are pressured to keep food on their shelves. However, it is a challenge in that all of them report a little differently. There are different groups of volunteers and very dedicated volunteers that run these important services throughout Renfrew County, but there's not a uniform way of administering food bank supplies. So some allow, weekly visits, some allow monthly. Different levels of food are given out with different visits. So it's hard to bring kind of a uniform report back as far as individual numbers. This report, the poverty analysis report that's in your package, does give some data from Feed Ontario. However, only a few of our local food banks are registered with Feed Ontario, so it does not include all of the data. So just wanted to share with this committee that there's some information here. However, I'm going to continue to engage with the food banks to support them in providing, a little bit more information so that we can, tangibly measure and share, some of the rising numbers that they are experiencing. And just as well to let this committee know, Amy Scholten, who's the executive director for the Renfrew County Legal Clinic, is a very strong advocate for individuals that are living in poverty in our community, and very connected with a number of the agencies that are working in this area, including the food banks. And she does sit on the food bank for one of the larger food banks, the Arnprior Food Bank. So certainly, if this committee would like more information about this report or some of this area, she certainly would be willing to come back as a delegation and provide, some more information around this report and some of the things that are being seen in this area. So just wanted to share that with the committee. Thank you.
Thank you. Are there any questions on any of the other items on the consent report? Member from North Algona Wilberforce, please.
Yes, I'll repeat my question from the first meeting. So just looking at the child services stats, The gap between the licensed spaces and the operating spaces, is that due to staffing challenges? Because I know we did receive funding for additional childcare spaces. So are we looking at a potential shortage on filling those spaces just because of the lack of staff? And what sort of plan do we maybe have to try and fill that gap?
Ms. Patrick, please.
Thank you, Chair, and through you to Councillor Brose. Yes, certainly lack of staff is, one of the primary factors as to why the operating spaces are so much less than the licensed spaces. Of course, through the regulations in the Ministry of Education, there's a lot of rules around the number of licensed early childhood educators to children ratios that needs to be in these centers in order to operate the rooms. And where the centers cannot attract and retain those staff, they're not able to provide those services. So certainly I know it's something that we've talked about quite a bit with this committee, and a lot of advocacy that's going on both at the local and provincial levels, something that you've heard our manager of children's services speak about. Our program analyst works very closely with all the daycare centers, and certainly brings back information to us regularly about some of the barriers that various centers are facing around staffing, and we look at what, if anything, can we do as a service system manager to support them with the needs that they're seeing in order to open more rooms and more spaces.
Okay. Are there any other questions on any of the consent? Member from Marne Prior, please.
Thank you, Chair. To Andrea, it's the community support. It says we do go to 80 and then 50 and the 80 during the winter months, the increase in your caseloads. Is that a winter thing?
Ms. Patrick.
Thank you, Chair, and through you to committee. We do see some seasonal fluctuations with our caseload numbers. As we know, there are individuals in Renfrew County, a significant number, who are seasonally employed, so we do see some variance that way. But certainly, noting overall, sort of from the beginning of 2024 to now, we are at a really pretty much an all-time high for our caseload. These caseloads are high. And that's something that we're continuing to look at and to monitor. I was reviewing some of the material from the Ministry of Children, Community and Social Services, and this was within their social assistance forecast document that had been shared with this committee. At a previous meeting, their forecast indicated that they expected County of Renfrew's caseload to be at 1340 for 2025-2026, and that was just based on labor market trends that they were seeing, and that was before some of the activity around the tariffs and some of those things that we're seeing. That was in fall 2024. So the rise in caseloads had been predicted by the province, and I think we're continuing to see additional pressure in those areas.
A member from Whitewater, please.
Thank you, Chair. I would like to take up the recommendation that Director Patrick had put forward about seeking a delegation on that poverty report. If that's something you'd like to consider, I would ask that it be considered. The second item I'd like to just address is the Warming Center final report. A tremendous document. Holy smokes. Really great appreciation now for all of the work that went into that interim solution. I'm glad we have a final solution, so I'll take that. I just wanted at the financials page, which if you're electronically, I think it's page 18, I don't know, but on the financials page, I was just hoping that maybe one of the staff could provide just an overview of provincial dollars versus lower or upper tier tax dollars that went into this effort. Is that possible to summarize to the closest $100,000?
Is that a question for Mr. Burke?
Through you, Madam Chair, yeah, happy to take that question. So the Warming Centre if we look at it in isolation of our broader activities under the MESA program, it received encampment dollars of approximately $100,000. That was a provincial fund for expenses between January 1st and March 31st, I believe. So that we utilized to the extent we could first. And then after that, we utilized contributions that were given from the city of Pembroke and the town of Petawawa, and I believe Laurentian Valley as well. So that's the warming center in isolation funding. So no tax dollars in the warming center component, and then the broader MESA component, you'll see later on in corporate services, the financial section, where the county share of that program is shown.
That's excellent. Thank you so much.
Okay, thank you. Are there any other questions? Warden, please.
Thank you, Chair. And I'll talk about the warming center. Just before I do that, though, 8B, the reloadable card. Congratulations to Finance and to Community Services for that program. And when you look at over 90% of the people receive their funding through direct deposit, that's a very significant movement from 2 or 3 years ago. And I think it does a couple things. It's great administratively, I imagine, because we're not processing paper checks. But at the same time, I think it also suggests to our clients that they're individuals and we treat them as responsible individuals. So congratulations. And the warming center, very quickly, because it was a great success. We had great municipal partners and partners in the community who serve clients. And when you look at our total visits of 2,100 with 1,400, nearly 1,500 overnight stays, and that was 132 people, unique people. And most of the people came from the Pembroke area. And 61% males, 36% female, and 3% other. So the ages, 6% were seniors aged over 65. So again, that's something that we should be aware of, a trend, I believe. And then when you move over to what the Heart Hub governance model is going to look like, those kinds of things. But again, just a tremendous thank you and gratitude to Mayor Gervais. I see him sitting in chambers for the excellent support we received from him and his staff, and also to Laurentian Valley through our member, and to Petawawa, to Mayor's service. Thank you to all of you for believing in it and allowing us to fund this as was mentioned, temporary measure. We weren't sure how temporary it was going to be. It forced us to really work hard and to collaborate, which we're willing to do, but then also to dream and build something. And that's what the Heart Hub application is became. So again, thank you. This was a very important step. Council, you reacted quickly to this and allowed us to feel our way forward. And I think when you look back, what tremendous success and what quite a journey. Thank you.
Okay, thank you. Are there any other questions or comments on the consent report? Seeing none. I'll continue on with the item B is the corporate services consent report. There are 2 items there to do with the POA. No? Oh, yeah. Member from Admiston Bromley, please.
Thank you very much, Chair Giardini. It's pretty much standing that I'll have my hand up when we're talking about the POA. And I do actually have to say here that I am encouraged that apparently one can move a brick wall with one's forehead. We are seeing a substantial increase year over year, 2025 to 2024, in the charges received. In fact, it is a 29, just shy of 30% increase. I'm kind of, and of course Ms. Wilton is not in the room, so I don't know perhaps if Mr. Burke might answer this. It is certainly understandable that there will be a lag between the time period of the charges being laid and resolution to the charges, be they dismissed or enforced. Because ultimately, there's just under a 30% increase in the fines levied, but we're seeing on the the Treasurer's report that we will engage in the next meeting of corporate services, we're seeing the fine revenue in the first quarter down by 33%. Now, it is understood that there will be a time lag there, but I wonder if Mr. Burke could kind of speak to that. Typically, what is, or if he's aware of, what is the typical horizon from the time of a charge levied until such time as resolution?
Mr. Burke, please.
Through you, Madam Chair, I wouldn't presume to know the typical lag there. I would assume that most charges are paid within the month they're laid. But I would make a comment on the volume of charges driving the revenue in POA. I should say that while traffic charges make up the bulk of our POA court in volume, the revenue is particularly susceptible to certain charges. So the heavy hitters are Ministry of Natural Resources fines and Ministry of Labor fines, where you could have a single charge amounting to $100,000, and that substantially will swing the revenue around. So in the past year, there were a few of those charges laid, which is why the POA did actually end up breaking even in 2024, or a little bit of revenue. But unless we see something similar, we would continue to see that decline in revenue, despite the increase in charges.
Supplemental?
Thank you very much, Madam Chair. And certainly I was remiss. It is, in fact, I'm always very careful. I do not perceive, nor should this be perceived as a revenue stream to fund operations. But when we had seen a dramatic, in my estimation, decline in the number of charges being levied, I had great concern over enforcement, and not just with respect to Highway Traffic Act. POA, of course, is the court of authority of competent jurisdiction in quite a number of issues. So the dramatic fall off of charges being levied were the larger concern. And in particular, as it pertains to this room, I'm surprised that we haven't today had any discussion about anyone speeding. Perhaps that is only reserved for operations committee reporting, because it typically is almost a standing item of traffic infractions and the lack of enforcement there. So I certainly take some comfort that we are seeing, at least on the quarterly report for the first quarter, a resurgence in the number of or what appears to be the increase in enforcement. Thank you.
Thank you. Are there any other questions or comments on the consent report items? A member from Pembroke, please.
Thank you, Madam Chair. I believe what I'm going to ask is somewhat relevant to this, but it does pertain to Provincial Offences Court, revenue enforcement, and it's an issue that we're seeing in the city of Pembroke pertaining to property standards. And I'm throwing it out there because if perhaps the city and the county was to join forces in terms of trying to address the province on this, perhaps there can be some movement on this. What it pertains to is in the city of Pembroke, the city laying charges in respect to property standards issues, I'll put it that way, and the municipality can continue to charge certain individuals over and over and over again and try to obtain fines, which then goes through this process. But ultimately, I believe what the intention is, and I think that's why the comment in terms of not being necessarily to raise revenue, but to if I can speak to the issue of being a deterrent to some individuals, or at least get them to do things that you want them to do. And in the city of Pembroke, there are certain homes that are in less than desirable state of repair, if I can put it that way. And as I understand it from the Ms. Sorio and staff, so we can have charges laid, goes through the court process, we get fines. Perhaps we even get a probation order that says that they're going to fix it, which they don't. And then we go through the process again. Provincial Offences Court, if anyone's been there, it's very difficult to send people to jail, trying to, again, get enforcement. So at the end of the day, if you're trying to correct people from speeding or get them, in this particular example that I'm giving you, is to fix their homes, I'm just raising it that perhaps there is a way to join forces in terms of addressing the issue with the province. My understanding is underneath the Municipal Act, the municipality can go in and fix their home and add it to the taxes, which is not exactly what I think that the municipality is supposed to be doing, is fixing people's homes. In any event, so I'm told that that's one thing. We've even had one particular property that was in such deplorable state that we had an engineering report saying that it was a safety concern and we're given authority to tear it down. So I guess what I'm raising is, I recognize what this report is about in terms of looking at the number of charges, revenue, the rate in which it's being dealt with, write-offs and so forth. So I'm just trying to take this opportunity to indicate that, and I don't know about the other municipalities, this is something we're not experiencing a lot of, but the properties that we are experiencing it's a drain on resources for our staff because they're constantly trying to deal with these problematic properties, and the tool that you have is the law, and that process seems to be flawed, if I can put it that way. Yes, again, we can continue to lay charges, get fines, maybe get probation orders and so forth, but it's not rectifying, in a number of instances, the problem. So I'm just throwing that out there, and so I apologize that this probably isn't the right committee that I throw it forward, but this is the one I sit on, and you're talking about provincial offenses. So, thank you.
So I don't know if there's anybody here who can comment on that. Mr. Burke. Thank you.
Through you, Madam Chair. Ashley will owe me for this one. So I would say that generally you are correct. We do struggle with the enforcement side, particularly from a fines collection, as you can see on the graph. Our method of collecting fines is collection agencies, and some of our peers do use property tax roll as a method of collection, but that's sort of our method. And I would say as a provincial direction, things have gotten worse, not better, since the removal of the requirement to renew your license plates, which used to be where we would have to collect on most of our Traffic Act fines. You would have to pay those before you could renew. With the dropping of that provision, one of our major collection tools has been taken away, that people can still have valid license plates without paying their outstanding fines every year. So it is perhaps something to consider, as what can the province change to help aid in our collection efforts, and staff can take that away and ponder what that would look like.
So are you good with that? Okay, all right.
Thank you.
A member from Deep River, please.
Thank you, Madam Chair. I was just thinking about something so outside of the Highway Traffic Act, when fines are levied, does the county have the capability of adding those outstanding fines after whatever period of time to the property tax bills? That's the first question. And the second, I don't know, but my second question is just in response to Mr. Burke's comment. While your license plates automatically renew in the province of Ontario, if you have outstanding Highway Traffic Act fines, your plates will not renew automatically, and the person will get a letter and actually has to go in and pay the fines. So that is still in the process.
Mr. Burke.
I believe through you, Madam Chair, I believe the ability to attach a ticket to a property tax roll is specific to certain types of offenses.
And as a common practice, no, we haven't done that. Our go-to method would be collection agencies. And we'll take your comment about the license plate renewal. I was not aware, but that's good to hear.
Thank you. Member for Madison Bromley, please.
For a little more clarity as well, one of the challenges is the County of Renfrew does not enforce property standards. Each of the lower tier municipalities enforces property standards. And what I would suggest is issues such as Mayor Jerva has raised, we are experiencing similar issues, that there does seem to be a bit of a revolving door surrounding that. So it is a challenge, but in terms of engaging, this is probably much more an ad hoc basis with the city as a single tier and the lower tiers as opposed to the upper tier municipality.
Thank you for that. Are there any other questions or comments? Seeing none, I have a recommendation. Where is my recommendation? That the consent reports be received as information. Can I get a mover and a seconder, please? Moved by the member from Head Claremont, seconded by the member from Laurentian Valley. All in favor? Carried. The next item on the agenda is a discussion report, the Community Services discussion report, and I will hand this over to Director Patrick, please.
Thank you, Chair, and through you to committee. So there are three resolutions in the discussion report. And if I may, Chair, I'll read the first one and to get it on the floor. And please bear with me as this is quite a lengthy item. So this is regarding the Ontario Works financial assistance rates. The recommendation is that the Community Services Committee recommends the County Council support the resolution passed by the Prince Edward, Lennox and Addington Social Services Committee at their April 10th, 2025 meeting, which states, whereas poverty is taking a devastating toll on communities, undermining a healthy and prosperous Ontario, with people in receipt of Ontario Works and Ontario Disability Support Program being disproportionately impacted, and whereas the cost of food, housing, medicine, and other essential items have outpaced the highest inflation rate seen in a generation, and whereas people in need of social assistance have been legislated into poverty, housing insecurity, hunger, poorer health, their motives questioned, and their dignity undermined. And whereas Ontario Works, OW, financial assistance rates have been frozen since 2018, $733 per month. And whereas Ontario Disability Support Program, ODSP, benefit rates have been increased by 6.5% as of July 2023, and another 4.5% as of July 2024 to keep up with inflation. However, even with the increase, ODSP rates still fall significantly below the disability-adjusted poverty line, $3,091 per month. And whereas OW and ODSP rates do not provide sufficient income for a basic standard of living, and as a result, hundreds of thousands of people across Ontario who rely on these programs live in poverty. And whereas designated service managers are doing their part, but do not have the resources, capacity, or tools to provide the necessary income and health-related supports to people experiencing poverty. And whereas leadership and urgent action is needed from the provincial government to immediately develop, resource, and implement a comprehensive plan to address the rising levels of poverty in Ontario, in particular for those on Ontario Works and Ontario Disability Support Programs. Now, therefore, be it resolved that Prince Edward, Lennox and Addington Committee requests that the provincial government to urgently, 1, increase Ontario Works rates to match the ODSP rate increases that have already been made and be indexed to inflation. 2, commit to ongoing cost of living increases above and beyond the rate of inflation to make up for the years they were frozen. And further, that a copy of this resolution be sent to the Minister of Children, Community and Social Services, the Minister of Health, the Minister of Municipal Affairs and Housing, the Association of Municipalities of Ontario, the Ontario Municipal Social Services Association, and all Ontario municipalities.
Can I get a mover and a seconder, please? Moved by the member from Petawawa, seconded by the member from Kulu, Haggerty, and Richards. Any comment or background, please?
Thank you, Chair, and through you to committee. we spoke about this a little bit at the last committee meeting as well, and I think with respect to the Ontario Works rates, which have been unchanged since 2018, as per Stats Canada, with inflation having risen by 24% from 2018 to 2024, the Ontario Works today should be 909.99 just to keep pace, as opposed to $733. So while the discussion is about rates not increasing, in fact, really they're being eroded from individuals that are living in poverty. And we are really seeing a lot of pressures, just throughout this report, speaking about the pressures on, local food banks, rising levels of food insecurity, difficulties with individuals affording rent, rising levels on our community housing wait lists. We're really seeing poverty growing in our communities, and a lot of pressure on the service system manager to really identify where we don't have funding and abilities to help everyone. How do we really help those in the deepest needs? And we're certainly seeing some shortfalls in some of our or pressures on the municipal tax base and our municipal budgets to fund, some of the programs such as our rent subsidy program. Every individual on Ontario Works, 1,200 individuals, certainly could benefit from and really need a rent allowance in order to bridge the gap between the cost of the rent and their social assistance income. And there's just, the needs are growing in our community, and we're continuing to see that rising. I'll leave it there, Chair. Thank you.
Are there any member from Bonnechere Valley, please?
Thank you, Madam Chair, and through you to the Director. Yeah, since 2018, not only has it been 7 years, but the world has changed. And I think this is not only timely, it might be behind the times. And just remember, you have to read this at the next County Council meeting. But I fully support this. And in fact, your assertion, Ms. Patrick, that 909, no, I would say it should be more than that. I mean, let's give these people enough so that they have a dignified way of living. So thank you. Thank you, Chair.
Member from Petawawa.
Thank you, Chair, and through you. I'm pleased to see this in front of us as well, and I support it fully. And I agree with the councillor from Bonnechere that 7 years is a long time. We have been advocating for this for a long time, without significant results, I would say, because it's been frozen for 7 years. And I think it's incumbent on us to advocate for this to happen, because the individuals who are experiencing this shortfall in funding often don't have the avenue to advocate for themselves. So it's up to us to keep doing something. So it's great to see this, and I wish there was more we could do. I think my question is, where's the symmetry between the various government departments? If the Ontario Disability Support Program has given increases because of inflation, why isn't Ontario Works working in symmetry with them? So I think the answer that I would like to see is why? Why are these government agencies not working together to ensure that there's sufficient funding for a dignified life for these individuals? And how do we get these answers?
How do we get these answers? That's, I'm going to be just, I don't think there is, I don't think we'd ever get an answer to that. But to Councillor Murphy's, are we asking enough? Like, should we be asking more? I don't know. Okay, well, go to the warden, please.
Thank you very much. I wholeheartedly endorse this, and I agree that we're not asking for enough. But when you take a look at the various basic income experiments, I guess they were termed experiments because they were terminated, both in Manitoba in the 70s and then more recently in Ontario, I think about 3 years ago. And it certainly indicated how much more positive that was than the doling out of small amounts of money once a month. I can't imagine how badly we're eroding the self-esteem of members of our community. You know, it's not those people as some refer to them. It's not them people as some refer to them. You know, it's not the failures of society as some refer to them. They're members of our community. You know, we have a community responsibility for everybody, and the responsibility differs. But in instances, as the member from Petawawa said, in instances where people can't or don't have the avenue to advocate for themselves, we have to do that. So I endorse this with the provision that I'm sure will be joining others in advocating for a more fairer distribution of income to people desperately in need in our community. They are our community members. Thank you.
Yes, and I believe this is an item on the list of the AMO list for delegations. Okay, back to Councillor Murphy, please.
Just very quickly, could I add a friendly amendment that you include Roma? Because although I think this is a problem across the province, I do believe that this is it is a rural issue, and both of these, or at least one of them, is in Zone 6 of Roma, so I'd be happy to speak to it. Thank you.
That can be done quite easily. Member from Edmonton Bromley, and then Killaloe Haggerty Richards, please, and then Whitewater.
Thank you very much, Madam Chair. And I did have, perhaps it was at our last meeting, I think I had a discussion with Ms. Patrick with respect to the freezing of these allocations. So ultimately, in freezing something, it is not freezing it. It is reducing it on an annualized basis. Every year, as part of our budgeting process, we give consideration to what is going to be our CPI, or our cost of living adjustment, to wages right across this entire municipal enterprise. So to put that into some perspective, if this is going back to 2018, it was 1.9% inflation annualized in 19, reduced to 0.7 in 19. Sorry, that was 20. 3.4% in 21, 6.8% in 22, 3.9% in 23, and I believe it's 2.5% in 24. Cumulatively, it's in excess of 20%. So ultimately, it is not frozen at 2018 amounts. It has eroded that it is now able to purchase at least 20% less than it was able to purchase in 2018. So don't let freezing perhaps delude anyone into thinking that essentially they are still getting, those folks that are absolutely reliant and dependent on these sums, they have seen a dramatic reduction in their purchasing value and erosion of their purchasing value. I think that perhaps oftentimes when one can kind of get rid of some of the formulas behind these things, it begins to resonate a lot more clearly in our community. I would ask anyone in this room, or anyone watching, or anyone that resides in the county of Renfrew, how they would feel if in fact their paychecks were reduced by the concomitant amount, or having been reduced 20% since 2018, because that is essentially, or if they were in fact frozen at 2018 and never saw any increase. I cannot imagine what our collective agreement negotiations might have been at the county of Renfrew if in fact over the last 7 years our opening position at all times had to been, we are going to freeze those. It would be not acceptable. We could not function as this municipal corporation. So how we could ask those that are leading the most perilous and precarious lives to adapt to that, it is appalling and completely unacceptable.
Thank you. Member from Killaloe Haggerty Richards, please.
Thank you, Chair. Yes, I'm totally in support of this, and I wish I knew what the right amount was, because I'd make that suggestion. But for each and every one of us, just imagine if we sat down and did our budgets, our municipal budgets, at the 2018 rate, where would our municipalities be right now? That's really scary. Thank you.
Thank you. Member from Whitewater?
Thank you, Chair. I'll just echo my support for the resolution. What came to mind when I read through the background, there's 100,000 people in Renfrew County. Right now, 1 in 4 are food insecure. It's 25,000 people. We ask ourselves, what difference can we make in the lives of those 25,000 people? And to me, I'm just curious, how many of those 25 are on ODSP and are on Ontario Works, and this would make a difference? This would change our stats from 1 in 4 to 1 in 6 or 1 in 7 or whatever the numbers. And I would ask staff to consider that for the next delegation, the next opportunity to really echo how we can make a difference in food insecurity. And I know that's not it. I mean, it's said very well in here. All we're doing is providing them income, but they still have to struggle with the lack of public transportation, the limited access to services, the higher costs. We're not solving all the problems, but we could at least ensure that people are eating correctly. So I just ask you to consider that. The other thing is I would strongly encourage with our new MPP, who's has probably seen much exposure to this as his time in Armpire, I would love to have him sit down with the staff from Director Patrick's and really appreciate what this means. Meet the staff that are doing this on a day-to-day basis and the difference that it could make in the lives of the people of this community, so that he can echo all of the comments that were heard today by the other members of council. So that's my input. Thank you.
Okay. Any other questions or comments? Seeing none, could I have a vote? All in favor? Carried. And continue on, Ms. Patrick, please.
Thank you, Chair, and through you to committee. So item number 2 is new operating agreements for nonprofit housing providers. So I'll read the recommendation. The recommendation is that the Community Services Committee recommends that County Council provide direction to staff to initiate negotiations with Killaloe and District Housing Corporation for a new operating agreement, and that this agreement be returned to County Council for approval. The new operating agreement is to adhere to the following principles: provide a term of not less than 15 years and not more than 20 years. Provide a predictable and reliable funding formula, which will provide funding levels consistent with the current 2025 funding levels, plus a mechanism to account for inflation. Allow for expansion with increased operating dollars to match increases in units. Support expansion by providing a dedicated capital subsidy for new units should the provider choose to expand. And simplify the annual reporting requirements for the provider.
Thank you. Could I get a mover and a seconder, please? Moved by the member from North Algona Wilberforce, seconded by the member from McNabb Braeside. Any questions, comments? Seeing none, all in favor? Oh, I'm sorry. Member from Whitewater. Put your hands back down.
Sorry, Chair, I didn't know if she was going to provide any additional background.
Can't you read the background?
Sorry, background, please.
Absolutely. Thank you, Chair. Through you to committee, and yes, I can certainly provide some brief background, and then perhaps committee may wish to invite our treasurer to speak a little bit more about the financials. But certainly, just high level, we have 5 housing providers in Renfrew County, in addition to our own Renfrew County Housing Corporation. All of our housing providers are really important partners with us in terms of providing subsidized and affordable housing for individuals in our community, and all of our nonprofit providers help us work towards achievement of the provincial target of 1,275 subsidized housing units in Renfrew County. So at the time of the download, many of these nonprofits held mortgages on their properties that were supported through operating agreements, and over time these have been paid off, and subsequently operating agreements have ended. So we are looking as staff at needing to create some new operating agreements. We've had meetings with certainly myself and the treasurer and Mr. Davis around potentially what those should look like and some of the considerations that have been talked about. We want to establish some clear terms and conditions so that our nonprofits can be supported and can understand what support they can receive from us as a service provider, both in terms of financial contributions and as well as some of our in-kind contributions that may be in the form of some support with tenant matters through my team or some support with technical expertise through Mr. Davis's team. So, maybe I'll pause there, Chair, and perhaps I know this was raised by Councillor Nicholson a little bit about if some of our providers may want to expand, how do we help incentivize them? So that's certainly something that we've considered, and perhaps Mr. Burke could add a little bit more detail there.
Mr. Burke, please.
Thank you, Madam Chair. And carrying on from Andrea's comment, yes, so when these agreements elapsed, technically so did the requirement for these organizations to provide low-income housing. Obviously, they as an organization didn't want to stop their mission, and we didn't want them to. So it's just time to clean this up, and our principle is to craft an agreement that will allow some leeway for expansion in the number of units. So right now, the agreements do not provide that. They're to fund the existing stock only. So we would like to either build in a capital component to help with any upfitting costs they may have, not to fund the actual capital expansion, but to help offset some of the costs, as well as an operating agreement that would allow it to increase should the number of units provided by that organization increase. With that, maybe I'll pause there.
Okay, thank you. Warden Nemo, you had your hand up?
Yes, thank you. And to the director, does this corporation have a board with an annual statement and an annual report? And that's my first question. My second question is, when we completed our building assessment or building condition assessment of all of our units, I believe we included their units as well. Is that true?
So your second question, I'm getting nods, yes, as an answer. Mr. Burke, would you like to take the first question?
Through you, Madam Chair, I believe the question was whether we get annual reporting from these organizations. The answer is yes, quite substantial reporting that is dictated by the province. It's about a 50-page report in a required format, which is the final bullet point there to simplify that annual reporting. Really, that is quite onerous, and we think we could get the same information for significantly less effort if we modified the agreement.
Thank you.
And supplemental.
Supplemental, please.
And just again, do we have a good? Do we have a sense that they're in good condition in terms of maintaining their building? And then secondly, that the board is healthy. Sometimes in volunteer organizations, the board and the membership start to shrink, and then at some point, the operating agreement is such that we take over the ownership. So I had some questions about the board, the health of the board, and stuff like that.
Okay, Ms. Patrick, please.
Thank you, Chair, and through you to the Warden. So with respect to the Killoo and District Housing Corporation, they do have a very active and innovative board. We do interact with them regularly, particularly through my team and the Manager of Community Housing. Certainly, we have a few operating agreements that are ready to be looked at and to be negotiated, as Mr. Burke indicated, but we are recommending that we start with Killoo and District because they do have an interest in potentially looking at ways that they may as well be able to help expand their supply, and so they've been in conversations with myself and Mr. Davis with regards to how may we be able to support and what maybe they be able to expect from us in terms of technical input, financial support, and perhaps Chair Mr. Davis may want to add some comments around that as well.
Mr. Davis, please.
The only comments I'll make, and through you, Chair, so we did partner with them through our BCA profile. So they do have a fulsome report of their buildings. Overall, to answer some of the questions, overall, they're a little bit better than our conditions. They're newer buildings than ours. Again, we received ours from the province back in the early 2000s, and some of these buildings are built in the 1950s and 60s, and the not-for-profits are relatively new and in better conditions than ours. And we always try to support them in a staffing perspective. If they need support from, as Director Patrick mentioned, kind of the softer supports, we do have a larger team than they do for some of the bigger construction projects or renovation projects, and they can lean on us when necessary.
Thank you. The two most important parts you answered is that the board is healthy and that the are in good shape. So thank you.
Okay, thank you. Member from Whitewater, did you have a question?
Of course he did.
This is a near and dear issue, so I'm going to keep going. I love the approach. I think the using the agreements to try to become visionary for the next whatever number of years, I think this is an excellent. I love that the issues that have been addressed and the way we can provide those soft supports, funding, capital investment in a limited fashion, I will note. I really, the example I just want to walk through quick, one of these housing units came to us, let's say one in Pembroke, and said, hey, we see your demand. You got 1,100 people looking for single units. We're going to produce 500 right now. CMHC will give us 80% of the funding. Will this agreement allow them to come to the table, work with us to try to facilitate the realization of that goal? Is that, or are we talking about really just managing the current assets or facilitating future expansion?
Mr. Burke, please.
Through you, Madam Chair, yes, that is our intention, to allow this nonprofit to expand up to a point. So they're very specifically geographically located in Killaloe, which you don't want all of your 1,000 units in Killaloe, but yes, it will allow them to expand. We haven't hashed out the details, but we probably will put an upper limit to what we're willing to pay for, should they wish to expand, but we will allow that. Or we aim to bring back an agreement that will enable that.
Okay, Councillor Burrows.
Yeah, just very quickly, I certainly support this. I think it's a great idea. And just to follow up on Mr. Burke's comment about the onerous 50-page reporting that is currently required, and I applaud staff for coming up with an agreement that's much more concise and compact, and maybe taking that as an example to a delegation to show the province what reduction in red tape looks like.
Good luck with that. Okay, are there any other comments or questions? Okay, now I'll call the vote. All in favor? Carried. And continue, Ms. Patrick, with item 3, please.
Thank you, Chair, and through you to committee. So the third and final resolution in my discussion report here is on master lease agreements with motels. So again, I'll read the recommendation to get it on the floor. The recommendation is that the Community Services Committee recommends that County Council delegate the authority to staff to enter into agreements with local motel owners to negotiate and establish room rates for blocks of rooms designated for supportive motel stays under the Homelessness Prevention and MESA programs.
Thank you. Could I get a mover and a seconder, please? Moved by the member from Bonnechere Valley, seconded by the member from McNabb Braeside. Background, please.
Thank you, Chair, and through you to committee. Just briefly, I think that this committee is well aware of all the efforts that have been going on within the MESA program to have a better, more robust, and more supportive, comprehensive approach to supporting individuals who are experiencing homelessness. We have always, for a very long time, through the Community Services Department, supported individuals in short-term motel stays, but we're looking to enhance and streamline that service delivery. And we want to, as part of what we have the opportunity in front of us through the Heart Hub, we heard earlier speaking about the warming center transitioning into a 24/7 year-round intake center for the Heart Hub, that when individuals are in there and are ready to start working with staff on some of the next steps, then eligible to go into a supportive motel stay, that we could then move them into motels where our outreach workers could work with them on some individualized goals and help them to move forward, you know, perhaps while they're waiting to go into the Heart Hub or after coming out of the Heart Hub. So it's in our best interest to establish some long-term lease agreements with local motels to ensure that we do have designated blocks of rooms. We want to streamline some of the administration for staff around extending motel stays, around issuing individual payments. We'd like to know the rooms that we have, know the availability, and be able to streamline some of this payments through our finance department as well. Thank you.
Thank you, Ms. Patrick. Member from Bonachir Valley, please.
Thank you, Madam Chair. I love this, I love this, I love this. Number one, I think a lot of our motels are underutilized or not utilized at all in the worst months of the year. Again, we talk about dignity, and I can't remember who it was that said, you know, these are not them or they. This could happen to any of us, anybody we love, and we want them to live with dignity. I think even being able to have a warm bed to sleep in and a good shower in the morning and a cup of coffee, I think could change the game for some of these people. When you talk about getting them in with different, you know, job seekers, life management, I cannot tell you how much I love this. When I read it, you know, Neil and I were just saying, this is probably the most difficult department that we deal with. We're talking about human beings, and they're so vulnerable. And when you read, you know, everything is so difficult. And when you read something like this, this gives me hope for some of our homeless. So thank you, thank you, thank you for doing this.
Thank you. Member from North Algona-Wilberforce, please.
Yeah, I would just echo everything that my colleague from Bonachir Valley said. And I think anybody who's had the opportunity to engage with Billy from Renfrew, who has started out having one of these motel rooms as a temporary transition place, and to see how far he has come, speaks a lot to the value of this program.
Thank you both, Councillors Brose and Murphy, for that. Any other comments? Okay, I'll call a vote. All in favor? Carried. I believe that's it for the discussion report. I could have a recommendation that the discussion report be filed. Received. I don't have it in front of me. Move in a seconder, please. Moved by the member from Whitewater, seconded by the member from Arnprior. All in favor? Carried. Okay, there are no deferred reports, no verbal reports, nothing for a closed session, nothing for new business. There is the next meeting, before I call for an adjournment, the next community services meeting will be in different order. We will be doing housing first, community services, followed by health, and then corporate services. No, we're followed by health.
If I may, if that's the June 12th meeting, I've asked the warden if we could put corporate services first.
Yes. Okay.
My apologies. I have a Roma board meeting in Ottawa, so I'd like to do that and then be able to leave.
Okay, so it'll be corporate services, Renfrew County Housing Corporation, community services, and then, no.
And then health.
Then health? Actually, no, I am wrong. So this is going to be the right order. Corporate services, health, Renfrew County Housing Corporation, community services. And there will be a message to follow to get this all straight.
Okay, and
But
we should,
corporate services will be the
Following
first meeting
county-
following county council.
and we should
Okay.
let Pembroke know.
Yes, oh, absolutely. Now that I've thoroughly messed that one up, could I have a mover and a seconder for adjournment, please? Moved by the member from McNabb-Brayside, seconded from the member from Petawawa. All in favor? Carried. We'll take a 5-minute break to switch chairs. Thank you.
Thank you. I'd like to call this meeting to order. Welcome everyone to the Corporate Services Committee meeting for Wednesday, May 14th at 3:09 p.m. This meeting is called to order. Ms. Wilson, has roll call been taken?
Through you, Chair. Yes, roll call has been taken and we have quorum.
And thank you. Is there any disclosures of pecuniary interest and the general nature thereof? Having seen none, I have a recommendation that the minutes of the April 9th, 2025 meeting be approved. Could I have a mover and a seconder? Deep River and Adamson Bromley. Any errors or omissions? All in favor? Thank you. There are no delegations or presentations for today's meeting. A link has been provided for the Municipal Property Assessment Corporation, MPAC, 2024 final report and audited financial statements. I have a recommendation that the communications be received as information. Could I have a mover and a seconder? Laurentian Valley and Head Clare and Mariah. All in favor? Oh, questions? Questions?
Thank you. More a point, Mr. Chair. I have made it a practice each year for several years now. Curiously, the 2024 audited financial statements are not available on their website. It does indicate in the report here that they are. There is the year-end report, and there is also a document called the performance report. In prior years, there was a downloadable copy of their approved audited financial statements, but that was not, or I could not find any link to that. There was simply a HTML page that gave a brief overview, but the audited statements themselves were not available.
Thank you for that. Should we direct that to Mr. Burke as far as talking with MPAC?
Through you, Mr. Chair, I do believe I did see them. They may have been attached as the original email or a separate area of their website, so we will track that down and distribute that audited financial statement from MPAC.
Thank you. Now, do we have a mover and a seconder? Oh, we did that? Any other questions? All those in favor? Carried. Now we'll move to consent reports. The consent report includes written items of important information that were provided for your review by the Treasurer. These items include item number 1, the Treasurer's report to March 31st, 2025. Item number 2, Council remuneration to March 31st, 2025. Item number 3, the information regarding the auditors presenting the 2024 draft audited financial statements directly to County Council and the RCHC Board at the June 12th, 2025 meeting. Were there any comments or questions on these consent items? Mr. Nicholson.
Thank you, Chair. Question just to follow up from our budget discussions in the fall. When I looked at the health reports for Bonnechere and Miramichi, I had expected that the salaries and benefits would have surpluses in it, not timing differences, only because we weren't able to staff all those positions. If I could just get Mr. Burke to review that point, if possible, please.
You may, and Mr. Burke.
Through you, Mr. Chair, I suspect there may be some of that, though the bulk of the variance there, the underspending, would be related to timing issues, which we don't normally have. But in this case, we were trying to had to do with how we back out our year-end accruals. And typically we would back those out at the same time we're booking the next year's accruals, and you wouldn't notice them. But we were trying to solve an issue we run into with mid-year reporting, specifically those programs that have March 31st reporting requirements. And as one typically finds, as we tried to solve one problem, we created another. And now we have this sort of an odd timing difference in some of our accruals. So I suspect there is a variance there, but the bulk of it would be related to pay period 1 unwinding that year-end accrual.
Thank you, Mr. Burke. Mr. Nicholson?
Just to follow up, thank you, Chair. Just on, and thank you, Mr. Burke, I appreciate that. The audited financial statements that are mentioned in paragraph 3, I love the fact that we're going to have an extension to the time limit for future discussion. I'm just wondering, will they be available earlier than normal? I know June is filling up with a bunch of other programming. Will we have access to those to review them with some extra time if possible?
And Mr. Burke?
Through you, Mr. Chair, I cannot make any promises for our auditors, but we will provide them to council as soon as we have them. We will say that.
Thank you. Were there any other comments or questions on these consent items? Yes, Mr. Donahue.
Excuse me. Thank you very much, Mr. Chair. I'm just furiously scrolling here. This is with respect to the Treasurer's report. A couple of questions for clarity. It's early in the year. This is only Q1. On members of council, recoveries other, there was nothing budgeted, but there's a pretty substantial recovery of just under $12,000. I wonder if Mr. Burke could address that.
Through you, Mr. Chair, that would be comprised of several items. So I think the largest one would be related to AMO and Roma boards refunding the members' expenses who attend those boards. Second to that would be the Warden's Golf Tournament sponsorships, I guess is the term. And then there is also an HST rebate related to county council travel expenses. That's what comprises that other account.
Second, Mr. Chair, once again, Mr. Burke, so it was budgeted, but I wonder if you could just remind me under general administration, what is the EOWC special project?
Through you, Mr. Chair, that is...
Poser.
That is eluding me. I was looking at Connie in hopes that she might remember. I believe it is a 5-year agreement related to cell phone EORN. That's the one. Our contribution towards the EORN cell project. Yeah.
I was under I thought that we had already provided that at the outset of this. So, two things. First off, I see that Warden Emo is still present and is a member of the Warden's Caucus. So, two questions. I have uncertainty. I thought that we had provided that up front, though it could be wrong. But even if I am wrong, then ultimately identified as EOWC would be incorrect. It should in fact be EORN.
I can actually answer that question if you can't see me on screen.
Mr. Kelly.
Great. Thank you, Chair. I believe we had already set our budget for the EOWC contributions, and then at some point in January, February, the EOWC made a budgetary increase, and I believe the special project increase was to handle some lobbying and other housing efforts that were going on, and above the already set budget that the County Council had already approved.
Outstanding. Thank you. I do have just a couple left, and this is more just from a perspective of providing overview. Again, we're only 1 quarter in, but draw committee's attention to the property Renfrew County Place in particularly, and these are a couple of the things I look at just kind of as indicators of the larger economy, and it is the line item light, heat, and power under Renfrew County Place. And committee will note that it's just a shade under $40,000 for the first quarter last year. We were 2 quarters in before we got to that number last year. Last year in Q1, it was only slightly over $15,000 lights, heat, and power. I'm wondering if perhaps some investigation on this could be calendar, though it is a substantial enough money that I would be surprised if it is just calendar that is accounting for that. We got 6 months in with that amount of money last year, and we've only got 3 months in this year. I'm not looking for the answer today, but I just wanted to put that in front of Mr. Burke as kind of a follow-up. The last comment that I have, and this created no shortage of consternation to the member from Admaston Brumley as I'm reviewing this, in trying to arrive at the overall enterprise surplus variance. All of the individual reports are identifying a deficit in parentheses, except for Renfrew County Housing Corporation. Renfrew County Housing Corporation, in fact, has a surplus in parentheses. That created quite a great deal of tearing of hair and gnashing of teeth for me to try and make a balance of this sort of thing. Perhaps there is a very sound reason why there is the disparity on all of the reports, and I am certainly, and now that I'm aware of that, I can accommodate, but I'm just kind of curious why it has been inverted for the RCHC financial reporting.
Through you, Mr. Chair. Force of habit, my apologies. No, you'll note though that we did go through an exercise substantially altering the RCHC reporting template to match what our budget was. So I think we can make that adjustment so it's in line with all the others. It was just a first showing of the newer groupings that we had budgeted for.
There was one more too, and Mr. Perkins might be able to speak to this. I note that, so let me back up a little bit. I note that there was some discussion in the narrative provided by Mr. Burke, which again, applaud him for doing so. It does provide a lot more illumination. But that there is some perhaps uncertainty of inventories, I think, that were left over that is likely to change, particularly the maintenance. But on the maintenance, what I wanted to draw all of committee's attention to, and Mr. Perkins, I have discussed this with, typically the estimation is that 60% of the winter control is used up in Q1 winter and 40% in Q4. So ultimately, if one uses that lens through which we're $16,000 under budget, on what should actually be the allocation of the total budget. It should, in fact, be $1.5 million, not $1.25 million. I think that as we move forward, and now that we've identified that we're, in fact, a $234 million operation here, that we can begin to be a little more sophisticated on our reporting to council, because a lot of these things are not broken up on a 25% basis. And I think that it provides a much greater level of detail and insight into how we are managing on a financial and fiscal basis over the course of the year, if in fact our year-to-date budgeting is more appropriate to how our costs are allocated and experienced over the course of the year, that might be something that could be worked on moving forward. Thank you, Mr. Chair.
Thank you. Are there any other comments or questions on these consent items? Having seen none, could I have a mover and a seconder to accept the report as information? Bonshire Valley and McNabb Braeside. All in favor? Thank you. And yes, this chair has been called many things today.
Could I, Mr. Chair, I know that we've approved it, but it's not by resolution. I did want to address item number 3. I thought that it was in the discussion report, but in fact, it is the consent. I wonder if you would indulge me. This is with respect to the financial statements, the audited financial statements.
And what would you want that separated?
Yes. And I know that there is no resolution here. There is ultimately, though, a staff recommendation that I actually disagree with. So I wonder how we would go about doing that. All eyes, I believe, are on the clerk. So it is, we are somewhat in uncertain territory given that there is no resolution here, but staff are making a recommendation just the same, and I wanted to speak against that recommendation, so I'm not sure how I go about doing that.
Sir, you could easily sever it from the report and talk about it separately.
What he said.
Fully anticipated that this would happen, sir.
You were much faster on that, Mr. Kelly, than I in fact was. However, I had a lot of pierogi at lunchtime.
The pierogi is real.
Ask. Do we now have to withdraw the vote? I'll make that.
Could I have a recommendation to sever this from the report? Mr. Donahue?
So requested.
Seconded by?
Oh, don't.
Just sever it? Okay, it's severed. Let's have discussion on item number 3.
So you want to have the vote on those items except number 3? No, but now you have to ask the mover and seconder if it's okay to remove number 3. Yes. Okay.
And who is the mover and the seconder of the 3 items?
I was the seconder.
You were the seconder. Bonchervelli was the mover? Yeah. Bonchervelli. Okay, both of yous? Yes. You're okay to sever? Yes. All in favor? Or just all in favor? Okay, that's... And now we can discuss item number 3. And I look no forward to Adamson Bromley to start it.
Thanks so much, Mr. Chair, and thank you so much for indulging this. Ultimately, the reason I'm bringing this forward is that I think that we have been diminishing the work of committees. I think that this same efficiency can be found if, in fact, the auditor is just, now that Committee of the Whole incorporates the entirety of council, that in fact it can be delivered to the Corporate Services Committee and still involve all of council. The reason it heretofore had been delivered twice was because there were only 8 members of council sat on the Finance and Administration Committee. So we can still get it reduced to a single presentation at the Corporate Services Committee in June. The report can be prepared, presented, all questions can be answered, asked and answered, and in fact I would dare say that there is more latitude with respect to procedure at committee than there is at council, that ultimately that would conclude with a recommendation of the Corporate Services Committee that council approve the audited financial statements for the preceding year. And where I'm going with that is in my memory I couldn't remember that the auditor was ever present by the time we passed the resolution to adopt. Typically, exclusively, the auditor's report at council was always made as a delegation. The motion to approve was made under the report from Finance and Administration Committee. Now, occasionally, I think once in the time that I've been here, F&A, Finance and Administration Committee, immediately followed the delegations, in which case there was some proximity to when it was, but typically it was about 3 hours from the time of the presentation until we actually got to the motion to adopt. So the suggestion here that the auditors prefer to be present, the only year that they were present was in 2017, and I know I could find that because Ms. Black was festooned in the red shirt for the Canada Day, for the sesquicentennial, and was present, in fact, I think, when we buried the time capsules. So it's only happened once. But ultimately, it is not predicated so much on that. It is predicated on, I think, that we continue to recognize the value that committees bring to this, and I think that it is appropriate that the Corporate Services Committee receive the audited statements, and from that, there is a recommending resolution to council. That was the intent. Certainly, when we moved to a Committee of the Whole structure, was that the work would still happen at Committee of the Whole, and then the authority would be exercised at council. So in fact, my recommendation here would be that we do not need the presentation at all at County Council, which would be 2 weeks after the June corporate services. whatever it would be, whenever if in fact we receive the auditor's report at Corporate Services Committee, that committee report is only made to council 2 weeks later, or occasionally it might be longer. So ultimately, we can recommend at committee adoption or approval of the audited financial statements, and council 2 weeks hence can simply approve that, which we will be doing 2 weeks from today for everything we entertained today. That is, since there's not a resolution here but a recommendation, I am speaking in opposition that in fact they be presented once, but that it be to committee rather than council.
Boncher-Valley.
Thank you, Mr. Chair. So number one, corporate services and this county council meeting are on the same day. In fact, when we moved the June 11th meeting to the 12th, I also knew that I had a conflict with Roma that day. And so in keeping with that, I asked if I could go first with corporate services, not realizing that we had another issue on the 12th with community services, but that the auditors could come to corporate services earlier rather than later that afternoon. When this proposal came forward, I see nothing wrong with it. It's the same day. You are literally talking, if the auditors came at 9:45 or they came at 1:45, I'm not sure what it matters if it's convenient to them and it's convenient to these chambers. I'm not sure what the reticence is when it's the exact same day. You're not even talking about, F&A is 1 week and 2 weeks later is county council. I thought it was very efficient. Thank you.
Adamson Bromley.
I do apologize. My rationale for this is that, in fact, the intent of moving to committee of the whole is that largely the business gets done at committee. So in moving more things directly to council, we're actually usurping, in my estimation, the value of the committees and eroding committees. This has been something that a committee would typically engage in, and then it simply makes a recommendation to county council, which would be, in this instance, then 2 weeks hence, because the committees always occur after the county council has ended. It is, in my estimation, an erosion of the utility of committees, and I think that this is appropriately should remain, for that reason, within Corporate Services Committee.
Mr. Burke.
Thank you, Mr. Chair. If I may add, the rationale behind having the delegation in county council was not so much to remove it from corporate services, but rather that it is very difficult for us to give an exact time of when a delegation would occur to a committee, given that they start sequentially. So Ms. Huber is very busy, as you can imagine, this time of year, and so she would like to know the exact time at which she can attend. That is the rationale behind having it as a delegation to county council. We can ensure that she is in fact first delegation to county council that day, beginning at 9:30, and she knows exactly when she can schedule her day around. That is the rationale behind taking it from committee into county council. That just to be able to provide an exact time. In terms of my other comment about the auditors would prefer to be present when it is approved, I don't mean so much that they would prefer to be present exactly when the motion is passed, but rather that their work, subsequent event testing and the like, continues up until the point the financial statements are approved. So on the date of approval. So while Ms. Black always attended both committee and council, the work does not end until county council day. So if they are coming, one of their subsequent event items of work is, of course, to hear the concerns of governance. If they are coming, they would prefer to come on the day that is actually approved, so that they can be sure that they've heard all of your concerns right up to the date of approval, as opposed to 2 weeks prior. I don't know that that's an exact hard and fast deal breaker, so to say, but I do believe that not being able to provide a time
for Miss Huber to attend would be a considerable hindrance to her. She would not like to spend the whole day on call waiting for the chance to present.
Thank you. Follow-up, Mr. Donahue.
So if by extension then, presumably Ms. Hubers then does not wish to be subjected to what the Pembroke City Councillors are subjected to today. Is that what I'm understanding correctly? Okay, thank you. In any event, my opposition stands. There is no resolution, so I don't know what the path forward is here.
Is there a resolution on the floor? Yes, Warden?
Thank you. I was going to suggest the same thing as you. If there was a resolution or direction to staff to change the order of business with the auditors, that's what I was going to suggest. Thank you.
Thank you. So we'll go along that route. Is there a resolution to be made?
I would move, so this has been severed. Mr. Kelly, do we need to set aside the rules of procedure if there's a motion coming forward on a consent item?
Through you, Chair, this is a committee, and this is where resolutions are heard. So this is a recommendation from this committee would be heard at council. So no, you do not necessarily need to set the rules aside. This is a discussion. You've brought it out to sever for discussion.
Okay, so to elevate a consent item at committee does not require a notice. Okay, thank you.
It does not.
So then I would move, Mr. Chair, that the draft audited financial statements are presented to the Corporate Services Committee at the June 12th committee date.
And do we have a seconder? Town of Deep River. And now we have to vote. All those in favor of the recommendation? Show of hands. You see 4? Can we see the hands again, please? And it is defeated.
Could I have a recorded vote, please, Mr. Chair?
Are we allowed to do a recorded vote? Yep. Yes, you may then.
Councillor Donahue.
4.
Councillor Bennett. Councillor Bennett, are you for or against the motion? Councillor Bennett, if you're for the recommendation, could you raise your hand, please?
That was fun.
Councillor Brose?
Against.
Councillor Doncaster?
In favor.
Warden Emo?
In favor.
Councillor Giardini?
Against.
Councillor Grills? For. Apologies, here we're sharing the mic.
Councillor Hodnott?
Against.
Councillor Lynch?
In favor?
Councillor Mayville?
Against.
Councillor Murphy?
Against.
Councillor Nicholson?
Against.
Councillor Service?
In favor.
Councillor Watt?
Against.
And Councillor Schulist?
In favor.
There was 7 for and 7 against. The motion has failed. 7-7. No. Not in committee.
And if I may, Mr. Chair, I think that this is a very unfair practice, and once a vote has been taken, it is taken. I think it's unfair when we know or when we think it might be a weighted vote, that in fact, once you see whose hands go up, and they're the municipalities with more votes than others, that if a motion is defeated and you go to a weighted, then all of a sudden it passes or has the potential to pass in council. I do not believe that once a vote has been taken, it should be allowed to go back to a recorded vote. Thank you.
Chair?
The last vote, if you don't hit enter, doesn't count, and I did not hit enter on the last vote, so the motion actually passes at 8-7. There's 15 in here. Sorry, that was my fault. I apologize, and thank you.
Yes.
And just further to that, so rules of order would dictate that that is an acceptable practice to call for a recorded vote at any time?
I agree with you. What I'm saying is it shouldn't be.
So now I believe item number 3 is no longer because the motion has been defeated, or the motions. Yes, so number 3 on here, on the consent item has been defeated. Has been dealt with.
Yes.
No.
Now you can move on to discussion.
Now we're going to move on to discussions, and this is going to be an easy day. What a way to break in. Now, the discussion reports. The CAO will speak to the administration discussion report and the recommendation.
Thank you, Chair, and good afternoon. I know it's been a long one for you, and I apologize for my absence. Item number 1 on my report is on the AMO conference and delegations, and if it so pleases committee, I'll read the recommendation. The Corporate Services Committee recommends to County Council that staff be directed to submit delegation requests at the upcoming Association of Municipalities of Ontario, or AMO, conference that are consistent with the 2023 to 2026 County of Renfrew Strategic Plan and other departmental strategic plans that address current initiatives that require further advocacy and/or address funding shortfalls.
Thank you. Could I have a mover and a seconder, please? North Algona Wilberforce and Head Clara and Mariah. Could I have the background, please?
Absolutely, Chair. So by way of background, of course, it is written here. You'll see a chart attached as your appendix. Now, the chart is very long, and I have to openly admit that this long list is far too inclusive, but it does bring out a number of possible suggestions for discussion of advocacy. As you are aware, the amount of capacity that staff and council have during AMO is limited. And of course, 20+ delegations would ultimately nearly be impossible to either be approved or to handle, quite honestly. So we are looking to have you consider these and maybe add to them, or again, mostly consider them and bring back any future ideas to the County Council meeting when this resolution is considered to be passed at that time, if it passes through committee. Again, the interior budget is released tomorrow. We are unaware of what's fully in that report. The Premier, as a child of the province, of course, the Premier is continuing on his quest to cut red tape and make things much easier for municipalities to operate, and we follow those on a daily basis, as we've learned over the last two plus days here in Toronto. So things are evolving, and we hope to, by the time of submission, which is May 30th, have a better understanding of the same page that we should be on with the province. So again, this list is not exhaustive, nor it is inclusive, but it is there for your discussion moving forward. Thank you, Chair.
Thank you. And any comments or questions? Monsieur Valley.
Thank you, Chair, and through you to the CAO. Yeah, Craig, you definitely gave us a lot to think about in this list, and in reading it, I realized there's no way neither staff nor the elected being at AMO, we would have to divide and conquer. Every single one of us, I think, would have to go and be on deck for delegations. My concern is that our next meeting is May 28th. And if we don't make some decisions, some cuts, some additions, I hope nobody's adding to this list. But if we don't make some decisions this afternoon, does that give you enough time to fully formulate your delegation request form? I mean, obviously you don't have to have your briefing note in, but even filling out that delegate request form, does it give you enough time between the afternoon of the 28th and the morning of the 30th?
Through you, Chair, I believe it will. Of course, if there are 20, that will take an amount of time. What I would suggest to you is that we've come a long way in some of our advocacy efforts, childcare, VTAC, and a few others where we have received permanent funding or substantial changes. And what we've learned at AMO at Roma is not necessarily to walk through the door with a thank you, but to come with a solution in mind. So I would hope that you would consider those items that we have solutions or possible movement, as opposed to walking in and just asking for further funding, because that's not what we're hearing.
Adamson Bromley.
Thank you very much. And I think perhaps somewhat similar concern to Councillor Murphy, but synthesizing a little bit. The concern in my estimation is our biggest fear is that we wouldn't get any. Second biggest fear is we get them all. I think that we certainly have seen with this government a propensity to entertain quite a large number of these. I will say, though, that both from the county perspective, but also from our perspective in Admaster Bromley, we have been granted kind of late-breaking delegations as well. So I think that we need to be very careful about overtaxing staff if, in fact, we were successful on these. Because ultimately, all of these, in my estimation, are worthy. But if, in fact, we were very successful and were awarded a lot of these, I think that we would have to turn down some of them, that they would be overtaxing, both from our staff perspective, but as I'm looking through these, as the chair of health, I'm thinking that if we were successful in quite a number of them, I wouldn't get to much of the conference at all, that I would be hopping from one delegation room to another delegation room. I cannot imagine the mileage that Mr. Kelly and the warden might put on. So I think that I would not suggest that we rein in the ones that we're applying to, but I think that we would have to be very pragmatic in establishing a number of how many we could reasonably do in a very prepared amount of, and be very prepared for those. And in fact, if awarded more than we could do, that we then communicate that we throw up some of these. I would not recommend that we right now prune back what we are attempting to do until we would see what our success rate would be.
Very good points. Yes, Arn Pryor.
Thank you, Chair. Just to look over to our Councillor Nicholson, who said earlier this morning, I want to bring that forward at this time. Now would be the time. You're advocating for something when we go to AMO.
Go ahead, Mr. Nicholson.
Thanks, Chair. I'm advocating for everything. No, I know what you mean. It was the OHT.
Yes.
And I did note that. Sorry, I was just kind of letting this conversation evolve to where it was going to go, and then I was going to jump in. So I'll give it, that's my thought. Yes, it's on my list. But I'll let the chair finish the discussion, and I can add at the end.
We are at the end of the discussion, so it's your turn.
Yeah, if we could add OHT to the list of considerations, please. But it was already in the resolution, so I'm assuming it would, by default, be added to the list.
It's noted. Are there any other questions? Oh, Warden, yes. Sorry, I'm not looking there.
That's okay. I can see myself in the big screen behind you. So one of the things to shorten the list, or not so much shorten it, but give it a little more flexibility for us is with regards to the OHT. I think we should tentatively leave it on the list, but at the same time start tomorrow with a campaign with Pembroke Regional and the OHT and ourselves to try and get an early meeting with the minister, because if you wait till AMO, then the government gets a little bit tied up with the fall, with the limited number of sittings, and then they have a fall economic statement, and then it moves to Thanksgiving and Christmas. So some of these, I think, if we continue to work on them, they may come off the list. The other one is the hydro line capacity. I really think that that's something that we should talk to Laurentian Valley and Pembroke about. That Laurentian Valley could take that on and we could support them. And when I look at the one about the improved municipal civil protection and train local volunteers, is that possible? Something that's the Whitewater might take on, given that their experiences, where we again could attend the meeting and assist with them. So I think if we look at a few of those, there may be ways of doing things a little differently, and that would cut down the number of the delegations that we might attend or might end up getting. Transportation expansion of Highway 417, Highway 17. I'll talk to Renfrew and see that if they put in the same request as we do, because I know that they've asked for the ministry to come to a town council meeting, so there may not be any benefit at all. So those are the kinds of things I think if we take a look through it, see if there's some partners that we can work with in our sector. That should cut the list a little bit. It'll still mean some work for us, but not as much.
Thank you. Are there any other questions or discussion? Yes, Mr. Nicholson.
Thank you, Chair. I love that perspective. And I think what the list gave me when I looked at it initially was just, I wasn't even aware of some of the issues. Like, they came to light as a result of all being brainstormed on there. And I really appreciate staff taking the time to get it all on one sheet of paper. I would make the argument that this isn't our AMO delegation list. This is our advocacy list.
Yeah.
We prioritize the advocacy list. Certain ones are done at AMO, certain ones are done in person, certain ones are just done with the MPP. Like, we could have a strategy for each one, or maybe that's what we could think of, and prioritize, as has been mentioned already before by a number, those which we want to invest the time in at AMO or Roma or whatever the case may be.
That's a great phrase. Thank you for that. Any other questions or discussion? Okay, so all in favor? Carried. The treasurer will now speak to the corporate service discussion report.
Thank you, Mr. Chair.
The resolution recommendation that the Corporate Services Committee recommends to County Council that the Economic Development O-Star Reserve, $35,000, be renamed to the Economic Development Reserve, and that the unclaimed and unspent funds from the Ottawa Valley Manufacturers Alliance Training Fund in the amount of $19,631.16, and the Ottawa Valley Manufacturers Alliance Marketing Fund, $957.11, be contributed to the Economic Development Reserve.
Thank you. Could I have a mover and a seconder? North Algona and Mr. He's not got a question. I can't ask him. I don't want to say his name. Is there anybody else? And Deep River. Could I have the background now, please?
Through you, Mr. Chair, we're just cleaning up a number of older, unused items that have been lingering on. So over the coming months, you're going to see a number of things come forward as we sort through these smaller amounts that have become historical items that we can't really do anything else with. So we're cleaning them up and putting them into their proper home where they can be used for future projects.
Thank you. Any comments or questions? Yes.
Just a single one. You'll be very pleased, Mr. Chair. So O-Star is just it's a legacy. There was a couple of years we had budgeted to get rid of it and just couldn't get that spent for whatever reason. It did diminish, I think in 17 from 40,000 to 35. I'm kind of curious though that the first I've ever become aware of this Ottawa Valley Manufacturers Alliance is today. It was this many years old. I'm wondering where that was housed. Again, this is not a capital reserve. It will be an other reserve, but where was it formerly held?
Through you, Mr. Chair, it was in accounts payable as repayable to this alliance as opposed to in a reserve. Again, I'm not familiar with the origins of it beyond we've attempted to locate the alliance in its current form, and we're sure it doesn't exist anymore. So we're rolling it over.
I think the Empire wiped them out, actually.
Any other questions or comments? Having seen none. All those in favor? Carried.
Thank you, Mr. Chair. Second recommendation, that the Corporate Services Committee recommends to County Council that $39,421.30 be transferred from the Community Paramedic Reserve to the Community Paramedic Long-Term Care Program to compensate for funding shortfalls during the 2024-2025 year.
And could I have a mover and a seconder to go on the floor? Monsieur Valley and Arn Pryor. Could I have the background, please?
Through you, Mr. Chair, committee will recall that the Community Paramedic Program operates about a $2.3 million budget. That number has been static for a number of years, and as part of the budget process, we continue to experience pressures as the funding does not expand, but the, of course, underlying costs do. And so this will be in order to make sure that there are no taxpayer costs, we will use this reserve to offset the overage inside that program. So again, more or less as per our 2025 budget.
Thank you. Any comments or questions? Adamson Bromley.
Thank you, Mr. Chair. I just wanted to note, and perhaps Mr. Burke can speak to this. So ultimately, we are seeing cost pressures because, once again, of a frozen amount for this community paramedic program. But I went back to the unaudited financial report that the Treasurer made a month ago. This reserve actually increased by almost $300,000 over the course of 2024. It ended $300,000 more in it than it started 2024. So I'm presuming that we must be experiencing then some surpluses in some companion programs?
Through you, Mr. Chair, no, oddly enough, in the 2023-24 community paramedic year, there was a surplus, so we underspent slightly. Some of that was timing around specific purchases of capital items that ended up in the 24-25 year instead of 23-24, just based on when they arrived. But also, we did have a surplus in the VTAC program during that year as well. So not exclusive to community paramedic, there was also another surplus inside the VTAC program. So those were the increases last year to the community paramedic reserve. This year, there'll be a slight decrease.
Okay, any other questions or discussion? Arn Pryor.
Thank you, Chair. To Mr. Burke, we're taking money from the reserves to top up what we owed for this year. Is that what I'm getting?
Through you, Mr. Chair, the funding does not cover all of the expenses. So we're taking money from the reserve to make sure that the program doesn't run as a deficit.
So I'm thinking next year, we're not going to have this money to put forward. Would that be correct?
Yes, that would be possible.
So we're going to have a bigger OZs next year because we're paying money from last year to bring this one equal? Does that make sense to anybody? So hypothetically, our bill for this year is $35,000. We're taking money from our reserves to equal that $35,000 to make it go. Next year in 2026, we're going to be in the hole because we've used our reserves. Where are we going to get the money to bring forward?
Through you, Mr. Chair, yeah, so there is the possibility that next year, the community paramedic reserve might be empty. We may not be able to repeat this maneuver to make sure that that program doesn't show as a deficit. That is a possibility. I would always say that the community paramedic reserve was built out of the surpluses in this program, and they should be used for this program. And we'll cross that bridge next year when we get there, but that is a possibility.
Sorry, if I might, though, going back to the unaudited financial statements that were
Adamson
provided in
Brownwood.
April.
Yes, you may ask a question now.
We started the year with $917,000 in the community paramedic reserve, and we're drawing out $40,000. So there will still be $880,000 in that reserve pending perhaps other cost pressures that might arise over the course of 2025. But all things being equal, that $40,000 would be available to us for another 22 years. But we're not going to drain that reserve account by dint of removing this $40,000.
Through you, Mr. Chair, yes, you are correct for this specific purpose. I would also say, though, that the Community Paramedic Reserve was one of the collection of the reserves we earmarked for our MESA program, which is massively drawing on reserves. So it's not only this that's coming out of that reserve. The Community Paramedic Reserve, along with our Safe Restart Reserve and our Cannabis Reserve, were earmarked as MESA reserves. And as you'll know, the MESA program is quite heavily leaning on those reserves, especially January through March of the current year. We're anticipating that the Heart Hub will now pick up the remainder of those expenses going forward, but I would suspect that we will be into that reserve for significantly more than $40,000 by the time we're come to ground on where the MESA program ends and the Heart Hub begins.
Monsieur Valley.
Thank you, Mr. Chair. All that being said, and I do agree with Mr. Burke, it's a healthy reserve, and this is where it should be spent. Thank you.
Thank you. Oh, and the warden.
Thank you. And again, that's been comments that have been shared with, the comments about Mesa have been shared with the province. We are in discussion with them to backdate some of the investments that we made earlier. Our comment to the government is we shouldn't be penalized for being innovative and quicker to respond than others. So we're having those conversations to try and to regain some of those fundings. I believe the Community Paramedicine Fund, Mr. Burke, it's 100% provincial dollars. It's not a combination of municipal and provincial dollars?
Through you, Mr. Chair, that's correct. It's two programs running side by side. One, what we call the legacy program for about $300,000, and then a $2 million provincial grant. So that's 100% funded up to that maximum funding envelope.
Okay, thank you. And so that reserve, is as I think the member from Boncher Valley said, it's the proper way. It's a proper investment. So thank you.
Any other questions or discussion? All in favor? Carried.
Thank you, Mr. Chair. Final recommendation from me that the Corporate Service Committee recommends to County Council that $123,303.16 be transferred to the Ottawa Valley Ontario Health Team Reserve, the amount being equivalent to the internal charge for County of Renfrew support to the OVOHT.
Could I have a mover and a seconder, please? North Algona. How come nobody wants to put up their hands? Too tired. Too many pierogies. Adamson Bromley and Head Clara Mariah. Could I have the background, please?
Yeah, thank you, Mr. Chair. The exact reverse of the previous resolution. So in this case, our funding envelope exceeds what we have spent during the current year. So we charge this program an admin fee, we collect the money, and then we shuffle that admin fee into the reserve for future requirements of the OVOHT.
Any comments or questions? Adamson Bromley.
Thank you, Mr. Chair. Just for clarity, and maybe I'm reading this wrong, so are these in fact costs that are incurred by the County of Renfrew in facilitating the administration of this?
Through you, Mr. Chair, there is no maximum admin charge under the OVOHT TPA. So yes, there are costs associated with running this. They are not exactly accounted for, nor is there a requirement to back the costs exactly.
My confusion, though, is are we permitted to recover just on a cost recovery basis? And if, in fact, these are costs that we have incurred, should that not be revenue to cover those costs and not put back into the OVOHT reserve?
Through you, Mr. Chair. So as part of our internal budget with the OVOHT, they do provide general revenue admin support to the County of Renfrew, $15,000 a year, which roughly equates to the staff time involved in the project. This exercise specifically over and above that is more of an exercise in maximizing the grant and retaining those funds in the local area.
Thank you for that. You're okay? Being everyone's okay, all in favor? Carried. And now we'll move to the Manager of Human Resources. We'll speak to the Human Resource Discussion Report.
Thank you, Mr. Chair. The recommendation is that the Corporate Services Committee recommends that County Council approve the following changes to the non-union staff salary grid within Employment Bylaw Number 1. 1. Reclassification and renaming due to altering of the following position: the MESA Coordinator to Program Advisor and moved from Group 8 to Group 10. And 2. The creation of the following position: a Heart Hub Site Manager in Group 11, and that the revised Employment Bylaw Number 1 be adopted.
Could I have a mover and a seconder, please, to put it on the floor? North Algona and Arnprior. Could I have the background, please?
Yes, sir. So there's to the reclassification of the MESA Coordinator to the Program Advisor. Obviously, when this position was initially created, MESA was new to us, and as we evolve with the role, we've redone the job description based on the actual roles and responsibilities that this person's taking on, and they're helping with more than actually just doing MESA. So we have created this new job description, run it through our job analysis system at the county to find its placement on our salary grid, and following our county policy B03, which is for the establishment of new positions. When we actually make significant alterations, there's a section outlined there that we're following here today. One little typo in my background is actually in the second paragraph. It indicates that the Ontario Works budget is capable of accommodating the change of the Heart Hub site manager. That wording should actually be in place with the MESA coordinator to program advisor, and so that piece of information is relative to this. The second piece of background is the creation of the Heart Hub site manager. With the creation of the Renfrew County Heart Hub and with the funding announcement from the Province of Ontario, the executive leadership team has begun to craft our organizational chart and create the positions with it. Some of our roles will be filled with secondments from other service providers. However, some of the roles necessitate creation of positions at the County of Renfrew, such as this Heart Hub site manager. We've created a job description for this position, reviewed it, and had it approved by the executive leadership group of the Heart Hub. Again, since it's the County of Renfrew position, it was scored using our job analysis tool, which recommended its placement in Group 11 on the grid, and the funds for this position are coming from the Heart Hub funding.
Any other comments or questions or discussion? Mr. Nicholson? Oh.
Thank you, and I acknowledge it's 4:10. We don't care. We're getting paid the same to be here.
He's in it for the long haul.
MESA. I was under the impression that MESA was going to be picked up by the Heart Hub funding. So is the Ontario Works just covering the gap until April 1st? Until the payments get sorted out? Or is this going to be an unfunded item in our next budget?
We don't know.
Through you, Mr. Chair. So I would say that MESA wasn't allocated as a department with unique costs, right? Those costs were all over the place. They were in paramedic service, they were in this, that, and the other thing. So the MESA coordinator was originally in Ontario Works, which has 50% funding, and the unfunded portion we were calling part of our MESA costs. So going forward, it's going to remain there, and there will be a pressure then on Ontario Works as it won't have the 50% MESA coverage after April 1st. If that answers your question. However, Ontario Works feels that they have some leeway there, that they'll still be on their budget even with this position being added in. Again, noted it's only 50% of the pressure because Ontario Works has 50% funding.
Wow. Adamson Brownlee.
Yeah, and I'm certainly on soft ground here, but I kind of alluded to that this morning in the Health Committee report. There are a lot of moving parts now to MESA that started out as a very discreet and thoroughly understandable because we took the bull by the horns and jumped ahead. Because I think SUAP is funding now. I don't know if that extends beyond the paramedic service, but I think SUAP is now going to be providing some of the funding that is going to displace the municipal component to MESA. And I think that there's still substantial uncertainty I think we're still working towards establishing where the TPA is going to be with respect to HART. And until such time as that is concluded, I think there remains some outstanding confirmation or certainty as to what is eligible, what is ineligible. I'm assuming that probably that should be a fairly short time horizon before we would expect to have more certainty. I don't know if I'm close. I don't know if Mr. Burke can shed any further light, or quite possibly even Ms. Patrick or Deputy Chief Grenier.
Ms. Patrick.
Thank you, Mr. Chair, and through you to committee. Just for the portion with respect to the Ontario Works budget, maybe I can just clarify a little bit for this committee with respect to the MESA coordinator position. And this was originally through our homelessness prevention program funding. and we had an opportunity in this year's budget to roll it into the Ontario Works budget, as we did have a little bit of room, as committee will recall, through Ontario Works with the province moving giving a little more opportunity for funding there. So we were able to roll that position in. I think, as has been indicated, lots of moving parts with respect to the Heart Hub, and with this evolution and role change, this will be an opportunity for the individual in the role to be focusing on the efforts in the Community Services Department and helping our management team to align our programs and services to make sure that we're in line with the MESA approach that we are supporting through a compassionate collaborative care approach, which is MESA. So that is something that we are able to absorb through Ontario Works and was budgeted in this year's budget. Hope that clarifies that portion of it. Thank you.
Thank you. And I think I missed Town of Petawawa.
Thank you, Chair, and through you. Just a question about the Heart Hub site manager. I understand the necessity for this position as we implement this brand new program. I guess my question is it a part-time role, a full-time role? And as time goes on, does the responsibility of this person or the need for oversight from this person lessen? And does this position, require less hours, I'm guessing? And is all this written into the agreement? Is it an open-ended contract, or is there something written in there that as time goes on, this position will eventually become redundant? And I understand that probably if the Heart Hub funding runs out, then this position will be eliminated. And is all of that written into the contract?
I'm not sure who would like to answer that.
Thank you, Mr. Chair. So the position is a full-time position currently. All of our contracts for any position have standard layoff clause in there that if funding was ever to be cut on any role, if you decided to outsource HR, my contract talks about that if you decided to lay the whole team off, you would just pay your Employment Standards Act notice period or provide actual written notice for a long enough time. If you had the foresight of the funding ending in 3 months, you could provide appropriate working notice so that there's no actual financial obligation past that. So that's in all of our employment contracts for any County of Renfrew non-union employee, and that is what's built into the contract for this person. The job description for this role is quite operational in nature, so I'm not sure that you would see this role specifically, drying up over time or the need, because they will be supervising at the site, managing the staff under them, etc. There are other roles within the organizational structure of the Heart Hub that perhaps, like you're saying, maybe more preliminary startup type things or oversight that after a certain period of time may dry up. And those roles, some of them have been filled with secondments from other organizations where people will return back to their home organization potentially after we've reached that sort of startup phase. And our fingers are crossed that these remain ongoing with funding for far longer than the 3-year pilot project. But again, all of our contracts have language in them around what would happen should funding end.
Thank you. Any other questions or discussion? All in favor? Carried. I have a recommendation that the discussion reports be received as presented. Could I have a mover and a seconder? Petawawa and Laurentian Valley. Anything further? All in favor? Carried. There are no deferred reports. Are there any verbal reports? Having seen none, there is no closed session. Is there any new business?
Thank you, Chair, and through you.
Mr. Perkins, you may speak.
Thank you, Chair, and through you. I'd be remiss if I didn't take this opportunity to congratulate Darren England, who's our patrol supervisor in Goshen Patrol. Darren's last day of work will be next Friday. He's going to take 6 weeks holidays, of course, but he's retiring after a 30-year career. So he's been with us for 20-something. I'll get the exact dates, but this is the last official meeting before he actually goes out the door. So I just wanted to wish Darren well. An absolute pleasure for me to work with him. And it's some big shoes to fill in the Goshen Patrol.
Thank you for that. Monsieur Valley.
And if I may, Mr. Chair, Well done. Your first chairing of corporate services. I appreciate the pinch hit.
Thank you. And it was supposed to be an easy meeting. Arm prayer.
Thank you, Chair. Just from Armpire, if you'd pass on our congratulations and time served for Darren. He looked after the Algonquin Trail from Lanark this way through Armpire. Fantastic job, grass cut, trees cut, all kinds of accolades. Thank you.
Thank you. Warden, yes.
Thank you, Chair, and may I offer my thanks for your work as well today. It was very well done. And to Mr. Perkins, if you could give Darren our congratulations as well. He did an awesome job with the Winter Games, setting up lighting, the parking lot. All to do was ask a question. Darren had an answer and an action with it at the same time. So you can't say anything about the efforts he made to make the games a success. So please extend the best wishes of the Ontario Winter Games as well as these chambers. Thank you.
Thank you for that. I have a recommendation that this meeting adjourn and the next regular meeting to be held on Thursday, June 12th, 2025. Could I have a mover and a seconder, please? Madam McNabb Brayside and Deep River. All in favor? We are adjourned. Thank you, everyone.